July FMGE exam, I have recorded this session of 100 Sawal Bemisal, and it is there on YouTube free for all. And some of the students, they told me that around 14 questions came directly from it, and it was very useful session. So if you are going through this session, please don't forget to see that first session also. पिछला जो सेशन था 100 सवाल बेमिसाल, वो भी जरूर देख लेना. ओके, जस्ट रिक्वेस्ट है थोड़ी. आओ शुरू करते हैं, और हम ना सिर्फ क्वेश्चन को गेस करेंगे, बल्कि ये भी कोशिश करेंगे कि वी शुड गेट ए फुल कमांड ओवर द टॉपिक एज वेल, नॉट जस्ट द क्वेश्चन. So this was one of the question in your recent FMG exam also. They had given you the graph and they asked which type of epidemic is there. So to identify the epidemic, there is 3 steps. First step is you have to look at the disease which they are talking about. Here the disease is cholera. Then you should know what is the incubation period of that disease. I think आप सबको incubation period पता होगा. वो gap जिसमें कीड़ा घुसा और पहला symptom या खांसी आई, है ना? Gap between entry and first symptom is incubation period. So the incubation period for cholera is 1 to 5 day maximum. और incubation period ही quarantine का duration होता है. Quarantine is done on healthy people, and we are going to keep that person separately till the time of appearance of symptom pass away. So cholera का incubation period 1 to 5 day है. इसके अलावा 2 और disease का इसमें जानना अभी जरूरी है हमारे लिए. Measles, इसका इंक्यूबेशन पीरियड होता है 10 to 14 डे, और हेपाटाइटिस ए का इंक्यूबेशन पीरियड होता है 10 to 50 डे. ओके, नाउ टू आइडेंटिफाई द प्लॉट, इफ ऑल द केसेस हैज ऑकर्ड विद इन 1 इंक्यूबेशन पीरियड, देन इट इज नोन एज कॉमन सोर्स सिंगल एक्सपोजर, एंड कॉमन सोर्स सिंगल एक्सपोजर इज ऑल्सो नोन एज पॉइंट सोर्स एपिडेमिक. टू बी कॉल इट पॉइंट सोर्स if all cases are within 1 incubation period. Now let's look at the graph. Here cases are starting from 19th of August. Let's say at least from 28 you can see. So cases started from 28th August, and then the cases keep on occurring till 27 of September. So that means 28 to 27 September is almost 30 day. So the time which take is 30 day. And they are talking about which disease? Cholera. So does all cases occur within 1 incubation period? कॉलरा का इंक्यूबेशन पीरियड है 5 दिन. अगर 5 दिन में सारे केस होंगे तभी हम इसको पॉइंट सोर्स कहेंगे या कॉमन सोर्स सिंगल एक्सपोजर कहेंगे. और यहां पे आप देख सकते हो कि केसेस 30 दिन तक हो रहे हैं, यानी इंक्यूबेशन पीरियड 5 दिन है, उससे ज्यादा टाइम लग रहा है. यू कैन सी द इंक्यूबेशन पीरियड इज 5 डे एंड केसेस आर ऑकरिंग टिल 30 डे. सो द केसेस आर टेकिंग मोर टाइम देन 1 इंक्यूबेशन पीरियड. सो इट कैन नॉट बी कॉमन सोर्स सिंगल एक्सपोजर. ओके, नाउ in propagated epidemic, there is a secondary wave of case. Like in case of COVID, there was secondary wave of case, na? So similar secondary wave occur in propagated. And you can see there is no secondary wave here. So it is not common source single, it is not propagated. Then the only answer that remain is common source continuous exposure. यही 3 टाइप की epidemic हैं. Okay, I hope you will remember. And the example of point source epidemic is all the food poisoning. If any food poisoning occur in hostel area, mostly they are example of common source single exposure. And example of propagated is all this COVID, SARS, MERS, all the pandemic are propagated. Okay, so here answer is common source continuous exposure. Let's have some more relevant question. They can give you a graph like this, and here they are talking about hepatitis A outbreak. So what is the incubation period for hepatitis A? 10 to 50 day. If cases are occurring within 50 day, within incubation period, we call it common source single exposure or point source epidemic. Now let's check how much time it is taking for cases to occur. Cases started occurring from 29th of April, and cases kept on happening till 21st of May. So that means it is roughly around 30 day time in which cases are occurring, and 30 day is within 1 incubation period. 30 day is below in the range of 10 to 50 day. So यहां पर सारे केस 50 दिन से पहले हो गए, एक इंक्यूबेशन पीरियड से पहले हो गए, इसलिए पॉइंट सोर्स है. एज ऑल केसेस आर ऑकरिंग इन 30 डे विच इज लेस देन इंक्यूबेशन पीरियड, सो वी कॉल इट एज कॉमन सोर्स सिंगल एक्सपोजर. एंड कॉमन सोर्स सिंगल एक्सपोजर इज ऑल्सो नोन एज पॉइंट सोर्स एपिडेमिक. ओके, इफ यू ड्रॉ ए कर्व इट विल लुक लाइक दिस. Sharp rise, sharp fall of cases within 1 incubation period. So it is point source or common source single exposure epidemic. Okay. Now let's have one more question. Suppose this question they have given. This is talking about salmonella infection, and they have written that salmonella infection have incubation period of 1 to 3 days. So if incubation period is 1 to 3 days, and you can see cases are coming from 13 May till 16 May. So cases are occurring starting from 13 May till 16 May. So 13, 14, 15, 16. Cases are taking more than 3 day time. Because it is more than 3 day, it is continuous exposure. If the cases were occurring in only 2 days, then it will become point source epidemic. But because cases are taking more than 3 days, it is common source continuous exposure epidemic. Okay, let's have one last graph for it. This was the graph which came in your FMGE exam. And in this, they are talking about measles outbreak. Cases started occurring from 4th of April and kept on occurring till 13th of May. So cases are definitely taking more than one incubation period. But main thing which you have to notice is, first some case occurred, and then there is a secondary wave of case. And whenever there is secondary wave of case, it is propagated epidemic. Okay, I think this concept is clear. This is a new type of question from which they are taking this type of image online and they are asking it. Secondary wave propagated within one incubation period, single exposure or point source. More than one incubation period, continuous exposure. That's the 3 way to answer it. I hope it is clear. If not, feel free to type it in the chat box. Okay. Thank you, Ajaydeep, and all my friends for answering. Come here. This is again a question which came in recent FMGE exam, and don't you dare to forget the PYQ topics and all, because in December exam, PYQ, December-January FMGE exam, PYQ questions they ask a lot. So always focus on this PYQ topics a lot, especially in December-January exam. Question is, if the CD4 count is less than 50, then out of these 4, which infection will occur? If you know the answer, please feel free to type it. Okay, now, my dear friends, there is a simple way to remember it. History is there. History. Histoplasmosis. History is very old. So history associated thing plus MAC, Mycobacterium avium complex, MAC, plus cytomegalovirus, CMV. These 3 things occur if CD4 count is less than 50. Can you remember these 3 words? History, MAC, and cytomegalovirus. These 3 are less than 50. Then between 50 to 200, there is toxoplasmosis, then all other oocysts, all oocysts except tuberculosis. Tuberculosis can occur even when CD4 count is more than 200. This is the thing for tuberculosis and vaginal candidiasis. But toxoplasmosis, psittacosis, a lot of oocysts are there in between 50 to 200. Let's see the image given in the park to make it more clear to all of us. CD4 count less than 50. In less than 50, there is disseminated MAC, histoplasmosis, CMV retinitis, and one more thing which I did not write there is CNS lymphoma. Okay? Sorry. In between 50 to 200, there is all oocysts, cryptococcosis, coccoidomycosis, toxoplasmosis, pneumocystosis, all are there. More than 200 are remaining things like Kaposi sarcoma, hairy leukoplakia, vaginal candidiasis, tuberculosis and all. तो इतना तो याद होगा नहीं, इसलिए सिंपल तरीका समझ लो, जितने भी ओसिस हैं वो सारे 50 से 200 के बीच में होंगे, हिस्टोप्लाज्मोसिस को छोड़ के जो नीचे आ जाएगा, और ट्यूबरकुलोसिस को छोड़ के जो ऊपर आ जाएगा, एक्सेप्ट हिस्टो which is less than 50 and tuberculosis which is more than 200, rest all osis are between 50 to 200. Okay? And through that you can answer this question. Remember the 4 thing which is less than CD count 50, MAC, CMV retinitis, CNS lymphoma and histoplasmosis. Okay dear? Next question. Which of the following is direct cause of maternal death? In the FMGE exam they had asked indirect cause, but they can ask direct cause also. We should have full concept of this thing. So direct and indirect simply means what can kill you or a mother without failing other system. Like if anemia occur, anemia will first lead to, let's say, cardiac failure or renal failure, and then patient will die. So anemia is indirect. If malaria occur, it will lead to, let's say, falciparum malaria. It can lead to renal failure or meningitis and all. And then again, patient will not die due to malaria, but due to renal failure or brain problem. So it is also indirect. Heart disease. This is not directly related with maternal situations. Anemia lead to heart disease, and then all these things occur. So if you ask the direct cause, the best answer will be embolism. Embolism can directly kill the mother. Again, in this question, we should take help of this graph given in Park textbook, which can help you understand it very well. See, if you can see this lower part. Let me zoom it if it is possible. Yes, let me zoom it. Can I zoom it? No, I cannot. So let me go there. Issue. No, I cannot. Okay, just listen what is written. I hope you can see, but listen it. Indirect cause include anemia, malaria, and heart disease. These are indirect, which I have written there. Anemia, malaria, heart disease, indirect. They do not directly cause the death to mother. Direct cause are ectopic pregnancy, embolism, anesthesia related. So if you can remember the direct thing, direct they are writing as ectopic pregnancy, embolism, anesthesia related. Anesthesia related, ectopic and embolism. And indirect are anemia, malaria, heart disease. Okay? Plus infection, eclampsia, these all severe bleeding, these are also direct cause. So in direct cause, you can have a lot of factor. It's better to remember indirect separately. And in indirect, there is anemia, malaria, heart disease. Okay? Rest all directly cause death. Okay, this is a wrongly pasted image. But in this, what I'm trying to say is that most common cause of maternal death is hemorrhage. And in hemorrhage, atonic uterus is most common cause of hemorrhage or PPH, you know. Atonic uterus is most common cause of PPH. After hemorrhage, second cause is other condition. And in this other condition, there is anemia. So anemia is indirect cause, second important cause. Then the third cause is sepsis, hypertensive disorder, abortion, and all those things. But remember, most common cause of maternal death is PPH. And in PPH, most common reason is atonic uterus. Second cause is indirect cause like anemia or malaria or heart disease. Okay, I hope you remember. Now, let's see, there's a question which they keep asking in pediatrics and PSM mixed. And I never discuss this question in any one of my class because I always leave it for pedia. But this is a very frequently asked question regarding classification of pneumonia and how to manage pneumonia in children. So first thing they will give you is a heart rate they will give you. Like here, the heart rate is 38 per minute. So for heart rate, remember, if it is less than 2 months, heart rate more than 60 per minute is considered as fast breathing. If it is 2 months to 1 year, more than 50 per minute respiratory rate, not heart rate, respiratory rate, sorry, very sorry for that. Fast breathing we are talking, so we have to talk about respiratory rate. Respiratory rate more than 60 for less than 2 months. For 2 months to 1 year, less than 50. More than 50 is fast breathing. And it should be less than 50. अगर 50 per minute से ज़्यादा है तो बच्चा fast breathe कर रहा है. And after 1 year, अगर बच्चा 40 से ज़्यादा बार सांस ले रहा है 1 मिनट में, तो इसको हम लोग कहते हैं fast breathing. तो please remember this point. Fast breathing is 60, 50, 40. 2 महीने से छोटे में 60 से ज़्यादा, 2 से 1 साल में 50, और 1 साल से ऊपर में 40 से ज़्यादा को fast breathing कहेंगे. Now here you can see that rate is 38 per minute, so it is fast breathing is absent. There is no fast breathing. Okay? But on examination there is chest in drawing. Chest in drawing इस part में lower coastal margin पे अंदर की ओर धंस रहा है. Chest in drawing हो रहा है. अब इसको किस कैटेगरी में डालोगे और कैसे मैनेज करोगे? तो मैनेजमेंट के लिए अगेन, ओ यार ये मैंने गड़बड़ कर दिया, इसको पेस्ट सही से करना चाहिए था. अभी मैंने जस्ट 1-2 इमेज पेस्ट किया है, बट मैं फिर भी इसको आपको समझा सकता हूं. देखो, पिंक कैटेगरी में हम लोग डालते हैं सीवियर निमोनिया को. सीवियर निमोनिया, और सीवियर निमोनिया का कहना है कि देयर शुड बी स्ट्राइडर. स्ट्राइडर मींस जब बच्चा सांस ले रहा है तो घर घर की आवाज आ रही है ना, देयर इज ब्रीदिंग साउंड बीइंग प्रोड्यूस्ड बाय चाइल्ड, दैट इज स्ट्राइडर टाइप ऑफ थिंग. Along with stridor, second thing is if there is any danger sign. What are the danger sign? Of course, convulsion is danger sign. Child is not responding to stimulus, sleepy all the time, that is danger sign. Child is not taking breast milk. Child is constantly vomiting again and again, not unstoppable vomiting. All this can be the danger sign. There is list of danger sign. You should go through it. So if there is danger sign or stridor while breathing, you classified it as severe anemia. It is pink category. And in severe anemia, the antibiotic of choice, drug of choice, is benzyl penicillin. Along with benzyl penicillin, because some patient can be allergic to penicillin, it can lead to anaphylactic shock also. So along with benzyl penicillin, we can, second drug which we give is gentamicin. So in a child, if you found stridor while breathing or danger sign, you will classify is that severe pneumonia and you will give the IM antibiotic, and after giving IM antibiotic, refer urgently to hospital. That is pink category, severe pneumonia. Second is pneumonia. Pneumonia is yellow. I cannot write, I can write in yellow, but I don't think it is so good visible. So yellow is only pneumonia. So there is severe and then pneumonia. There is nothing like mild or moderate pneumonia. In yellow category, there is chest indrawing or fast breathing. Any one of the two. If the child is having chest indrawing or fast breathing, it is pneumonia category. And again, fast breathing we have discussed. Chest indrawing is here. Now, in this yellow category pneumonia, what we do? Here, we give amoxicillin syrup for 5 days. Simple answer, amoxicillin syrup 5 days. And then, of course, after 5 days, we will ask the mother to come back. After this, last category is always green. And we all know green signal means move ahead, go, everything is okay. So green means no pneumonia. So that means there is only 3 things. Pink, severe pneumonia, benzyl penicillin gentamicin. Yellow, pneumonia with fast breathing or stridor, amoxicillin for 5 days. And last is green, no pneumonia. So we will reassure the mother and ask to follow up, and we will tell her the danger sign. If that sign develops, then come back. So now let's go back to the question. Question is saying that the child is having chest indrawing, fast breathing is absent, but chest indrawing is there. So if chest indrawing is there, and they have not written stridor, or the child have convulsion or cyanosis or anything, so urgent referral is not needed, because urgent referral is for severe pneumonia. It is not the case. Oral amoxicillin for 5 days. This is the treatment which we give for pneumonia. So correct answer is A, oral amoxicillin for 5 days. IV antibiotics, if we are giving like gentamicin and penicillin, we do not ask the child to come back after 24 hours. After giving IV antibiotic, we refer to higher center. So anyway, logically, option C is wrong. And antipyretics means paracetamol and all. If there is some problem, starting paracetamol urgently is not of much use. And a main role is of antibiotics if there is severe pneumonia, okay? Or if pneumonia, amoxicillin. So correct answer is A. I hope you can manage and remember this part. This is very important. Yes. Now, let's move ahead. Jimmy Jaipur wants general danger sign. General danger sign, as I said, C for convulsion, C for cyanosis, bluish of and all. Convulsion, cyanosis. Then there is this thing. Child is not responding. He is a lethargic child, completely lethargic. And child is having recurrent vomiting. And then child is not drinking breast milk for a very long duration. These are, lethargic is like that only. Lethargic, unresponding, and not drinking breast milk. And then recurrent vomitings can be taken as danger sign. There are other danger sign also. I am also missing some of them. So go through that. And this is the same classification being given in 2 places, in PARC as well as in WHO guidelines. So I am putting it there. Now let's come to a recent question which they are asking from a snake bite. 2 times they have asked question from here. Do it right is a logo which Government of India came out with for a snake bite. So which of the following is not done in do it right? First is reassurance. We do it. Reassurance, R stand for reassurance. Reassurance means around 95% of the snake are non-poisonous. So we will tell the patient that you will not die for sure. 95% chances you will survive. So don't be in a panic, reassure. Then second is I. Can you tell me the answer of this question, which is not included in do it right strategy? Very good. Correct answer, my dear friend, Gokul and Kausal Suman and Ria. All 3 of you are right. In season is not done. So what is this I? I means immobilization. Immobilization means we will not allow the patient to walk till the hospital. Either we will take him on some wheelchair or stretcher on soldier, but if the patient is walking, then that blood supply will mix and the poison will also mix in the body very quickly. So I is immobilization, in season is not done. Then what is G and H? G and H stand for go to hospital. And T is tell the sequence of event in detail after the bite. That are you feeling drowsy after it, or is there any redness over there and all. Okay, so this is the thing which we do. We do not do in season. We do not do suturing. In season suturing, these are never done in rabies or snake bite. We never do suturing in season like that. You can use some bandage like thing, but no need of doing suturing here. And one more question they ask in NEET exam, which is having hemolytic poison. Viper is having hemolytic poison along with other also, but Viper is hemolytic. Okay, so let's move ahead. Okay, there is a lot of question which they are asking from vitamin A supplementation and dose. Let me tell you one extra point here, that if the age of the child is less than 6 months, then vitamin A given is 50,000 international unit. If the weight of the child is less than 8 kg and age is less than 12 months, we give 1 lakh. If the age is more than 12 months, and let's say if age is 18 months and weight is 7 kg, so how much vitamin A you will give? Weight is less than 8 kg. So whenever it is less than 8 kg, the answer will be 1 lakh international unit. If the weight is less than 8 kg, we always give 1 lakh international unit, not 2 lakh international unit. And I hope you know that first dose we give at 9 months 1 lakh, and after 9 months we give 2 lakh international unit every 6 months, 2 lakh international unit every 6 months till 5 years of age. Okay, so this is the regime which we give, and under this regime, for taking vitamin A syrup, mother have to go to hospital 9 times. 9 visit is there, and total 17 lakh international unit of vitamin A they will take. And do remember, if someone is having, let's say, bite spot or night blindness and all, then the treatment which we give is 3 doses, 1, 2, 14. Today, tomorrow, and 14 day. 3 doses vitamin A we give for treatment. And they ask it very commonly that what is the first sign of vitamin A deficiency? What is the first sign? Can you tell me the first sign of vitamin A deficiency? And what is the first symptom of vitamin A deficiency? First symptom and first sign. First tell me first sign of vitamin A deficiency. Sign is something which doctors see in patient. And first sign is not night blindness. First sign is conjunctival xerosis. Conjunctival xerosis. There was a doctor who described that conjunctival xerosis की ऐसा लगता है जैसे सागर की लहरों पर रेत की एक परत हो. क्या कहना चाह रहा है कवि? Actually, in xerophthalmia or dry eye, due to vitamin A deficiency, there is less secretion of tear. So the dust particle will deposit in the eye, and there will be some dust, some tear, some dust, some tear. So it will look like sand on tide. That is the first sign, conjunctival xerosis. The second sign is bite spot. And क्या आपको लगता है कि आशा इतनी आंखों में डीप जा करके कंजंक्टाइवल जीरोसिस खोज पाएंगी? बहुत मुश्किल है ना? It's very difficult to look for conjunctival xerosis. So if they ask, what is the thing which we use for screening of vitamin A deficiency? So screening is done by bite spot. Bite spot is used for screening of vitamin A deficiency. And what is the first symptom? First symptom is night blindness. Okay, so it is there. One last information which I want to give is, they have asked the rule of half, and they ask what is the innermost circle is telling us. So innermost circle is telling us the patient who are adequately treated, who are getting the treatment perfectly. Okay, what are the other circle? It is written there. You can see it yourself. But main thing, innermost circle is adequately treated. One more question they have asked it, that there are 20 patients, their BP were being followed for some 10-20 years. And it was found that children with lower BP at the beginning also have lower BP at the end. And children with higher BP at the beginning also have higher BP at the end. So which phenomena is this? This phenomena is known as tracking phenomena. बहुत सिंपल है. ट्रैकिंग फेनोमेना का सिंपल मतलब है कि बीपी हमारा पीछा कर रही है. अगर बीपी बचपन में बड़ा हो गया तो जवानी बुढ़ापे तक भी ज्यादा रहेगा. If BP is high at a younger age, it will remain high at older age. That is tracking phenomena. And this is rule of half, which you know, the lowermost circle is adequately treated. Okay. Very good, Richa Singh and ZV, you were right. That was tracking phenomena. Yes. Chalo, now let's move ahead. Let's do some question now directly. Choose the correct order of steps of disaster management. Let's see whether you can answer it or not. Disaster management cycle is very important, remember. It starts with impact. After impact, there is triple R. What are this triple R? First R is rescue and relief. Second R is rehabilitation. तो अगर आप लोगों को ले जा रहे हो ऊंचाई पे वादियों में और वहां ले जाकर के कह रहे हो कि हगो, है ना, डिफिकेशन इन ए सेफ प्लेस, इज इट rehabilitation? It's not rehabilitation. Rehabilitation means giving them their job back, making them self-dependent. So rehabilitation takes time. If you are shifting people to high place, that is rescue. And that is the first step of preventing people from dying due to loose motions and all during flood and cholera, okay, that they should not defecate in the same water, otherwise the loose motions will keep on happening. So after rescue rehabilitation, the third is reconstruction of their homes and building. Reconstruction. If you add all these three, it will become recovery. ऊपर में से आंसर देना, which do you think is the correct answer, ABCD, that you have to give. And after this reconstruction or recovery, we do mitigation. Mitigation means decreasing impact of future disaster. For example, if you are making earthquake proof building who will not fall down so quickly on earthquake, that is mitigation. You are trying to prevent future disaster. After mitigation, there is preparedness. Preparedness means you will assemble the rescue team, you will recruit doctors and other people who will work during disaster. So preparedness is not such a big thing. Big thing is mitigation, decreasing impact of future disaster. And after preparedness, there is impact. So this is the cycle of event. How will you remember it? A very simple way of remembering it can be triple R. And you have seen that movie, na? Triple R. And suppose triple R went to MP to have some bhang or something in Ujjain and all. And after having bhang and all, there will be impact. They will be high or something. So what this triple R means? Rescue, rehabilitation, reconstruction, then mitigation, then preparedness. And of course, whether you are prepared or not, there will be next impact. So impact will always be there. So triple R MP is the sequence. Now let's arrange it. Impact, directly mitigation, no. First is wrong. Impact, response, rehabilitation, mitigation. It looks correct, second option. Rehabilitation, then response, then disaster, it is completely wrong. And response, impact after response. First impact, then response. Na? So of course, all three are wrong. Option B is correct. And I hope many of you have given it correct answer. Yes, Saurav Raj, Kausal Suman, Nida Ansari, Ajauddin Khan, thank you for replying. You all are correct. Very good, my friends. Now, chi-square test will test association of which of the following? Out of these four, for which we will use chi-square test? Try to reply. See, chi-square test is used for qualitative data. And qualitative data simply means categorical data, which we cannot measure, but which we can classify in category. For example, if I ask my obesity is quantity or quality, what will you answer? Quantity or quality? You cannot measure my obesity. You can only measure my weight. Obesity, if I ask, obesity you can only categorize into mild, moderate, severe obesity. आप बस कह सकते हो कि मोटे तो ज़्यादा मोटा हो गया, बहुत ज़्यादा मोटा हो गया, फटने वाला है. That is just category. What you can measure is weight. Similarly, if I ask anemia, can you measure anemia? No, you can measure hemoglobin but not anemia. So जितनी भी बीमारियां होती हैं, all illnesses are categorical. Obesity, anemia, hypertension, diabetes mellitus, all are qualitative, and weight, height, BP, HB, whatever we are measuring, these are quantitative. And the other word of quantitative is continuous. Quantitative is also known as continuous. Ab dekho, in recent INICT exam, they ask a very good question. And whatever came in 2-3 year INICT NEET can come in FMG and vice versa also. FMG question they also took in NEET exam. And many a time, almost every time. So they exchange the question. So we should be ready. The question they ask is that median and mode, they are used for quantitative or qualitative. So remember, if we have quantitative data which we can measure, like weight, height, BP, HB, there we use mean. But in case of qualitative or categorical data, we use median or mode. Median and mode are for qualitative data. And along with median and mode, most of the time categorical data result comes in percentage or proportion. Percentage and proportion is the way for describing categorical. Like I can say 20% of students in this class are obese. So 20%, 20 out of 100. Obese is a categorical data and I'm using percentage. Okay. So now, this chi-square test, as I said, is used for qualitative data. तो आपको बस इन चारों ऑप्शन में से देख के ये पता लगाना है कि कैटेगोरिकल या क्वालिटेटिव डेटा कौन है, वही आंसर होगा. You just have to find out which one is qualitative. That will be the answer. So let's see. Age. Can you measure age? Yes, I am measuring it every time. Serum cholesterol we can measure. So it cannot be qualitative. It is quantity. We can measure it. Heart rate, body mass index we can measure. That is also quantitative. Sex. Can you measure sex? I cannot say that you are 3.2 male. I am 1.9 male. I cannot say like that. So sex we cannot measure. Type of cancer is also category. First stage, second stage, and which organ and all. So sex and type of cancer are qualitative. So for them we will use chi-square test. Remember, we use chi-square test whenever there is more than or two groups of people and data is qualitative, which can only be categorized. Like sex, your race, your body color, your other organ color, all of these are categorical. Now, second step is, if you found that you can measure the data is quantitative. So if data is quantitative or continuous, you have to see these three things. First, in the question, are they using pre and post test word? क्या क्वेश्चन में प्री पोस्ट बिफोर आफ्टर लिखा हुआ है? और आर इन द क्वेश्चन दे आर यूजिंग द वर्ड मैच डेटा. अगर आपको क्वेश्चन में इन तीनों में से कोई भी वर्ड दिखाई दिया, एनी ऑफ द थ्री वर्ड यू फाउंड इन द क्वेश्चन, योर आंसर विल बी पेयर्ड टी टेस्ट. And paired t-test is also known as dependent t-test because they are dependent on the same one group of people. Okay. So in this, if this three word is written, answer is paired t-test, dependent t-test. Now, if data is quantitative and there are two group, in case of two group, we apply unpaired t-test, and unpaired is also known as student t-test. And it is also known as independent t-test. So, independent, unpaired, student. These are for two group. And if there is three or more than three group, then we apply ANOVA. ANOVA full form is analysis of variance. Okay. So now I will give you a question, and let's see whether you understood this topic completely or not. Through that question, I will get the idea. So let me give you an imaginary question. No, not this. Let's have a question. Question is, effect of smoking on lung capacity. Lung capacity, okay? On lung capacity of two group of people, two group of participant can be compared by. So, which test you will apply here? Option are A, paired t-test, B, unpaired t-test, C, ANOVA, or D, chi-square test. Give me the answer. I'm waiting for your answer. Dr. Ambika is correct. It is a quantitative data. Very good, Ambika. Lung capacity we can measure. Saifali is saying yes, lung he. Yes, very good, Saifali. You naughty boy. And Ria, Manaswi, Priyadarshini, Richa, Singh, Jadvi, Karthik, all are saying unpaired. So you have this concept very clear, very good. Because there are two groups. And data is lung capacity which we can measure. It is measurable data. So, quantitative data, two group, answer is unpaired. Now, in the same question, if I change the language and I ask it, effect of smoking on percentage of student having cough. Percentage of student having cough in two group of participant. So this time I am not finding effect of smoking on lung capacity, effect of smoking on percentage of student having cough. Now which test you will apply? See, cough is category. You can have mild cough, moderate cough, severe cough. And anyway, the data is in percentage. Percentage and proportion are for qualitative data. Cough is also qualitative. So here, which test you will apply? Chi-square test. Percentage of student having cough, if they change, chi-square. In the same question, if I am trying to find effect of smoking on lung capacity of three group of student, 3 group, answer will be ANOVA. And in the same question, if I ask effect of smoking on lung capacity before and after smoking, before and after if I apply, answer will be paired T test. So, my dear friend, this is the one type of question from which they can ask all the 4 things. So, I hope this concept is clear to all of you. Okay. Now, let's move ahead. Next question. They have given sample size of 3 study, 1, 2, 3. This is pink one is 1, the blue one is 2, the gray one is 3, the lowermost is 3. And they said, what is the margin of error will be? In which graph the error will be maximum? So my dear friend, do remember, all kind of error and range of confidence interval. These 2 things, range of confidence interval and standard error, or any standard error, standard deviation, all of these things. But mostly standard error and range of confidence interval. These are inversely proportional to sample size. If your sample size is more, error will be less and range of confidence interval will also be less. This was the question in recent exam, do remember it. Let me explain it with an example. Suppose you are running and I am asking how long you will run. And you said, sir, I can run, I am 95% sure I can run between 800 meter to 1 kilometer. So this is your 95% confidence interval. Within this confidence interval, you will somewhere stop. And how come you are sure that you will run in this range? Because you usually run, like, and only a runner can be so precise. If you are not a runner, suppose you are asking this question to me, ki how long you will run. So I will say I will run between 50 meter to 1 kilometer. This is my range. Why? Because I'm not running, so I don't know my range. So in this first scenario, when answer was 800 to 1 kilometer, someone is running every day. So the observation is done frequently, sample size is more. And because sample size is more, the range of confidence interval is small. The error is less, data is precise. And in the second example, when I was running, the range of this was big range of confidence interval. Why big range? Because I have not run earlier. My sample size was small. So if sample size is small, the answer will be big in range. And if the sample size is large, then confidence interval range will be small. And which type of, out of these 2 data, which is a better quality data? Which answer is better? 800 meter to 1 kilometer is a better answer, because it is telling about the health of the person, that he is having a good health. My range is not giving us any idea. So remember, a small range of confidence interval, more significant data. Okay? I think this is clear to you. But let me explain it with one more example, simple example. Suppose I ask this question to Dr. Richa, that Richa, how much marks you will get in the FMGE exam, which you are going to give this January. So Richa will say that, sir, I am 95% sure I will get between, let's say, 180 to 200 marks. Richa has done very good preparation, so she's saying like that, suppose. Now, suppose I ask this question, Richa is final year and she is preparing, and she has done MBBS and now she is preparing. But suppose I ask this question to first year MBBS student who just went to Kyrgyzstan and studying in Jalalabad University, and I just asked him how much marks you will get when you will give your FMGE exam 5 years after that. So he said, sir, I am 100% sure I will get between 0 to 300 marks. 100% sure. So which data is better data? Of course, you can understand. Richa data is giving us clear idea whether she will pass or not, and she will pass with very good marks. So this is more significant data. Okay, which data is more significant? The data, more significant data have a smaller confidence interval and a small error. The data which is small to the point is a better quality data. Now, why Richa is so sure that she will get between 180 to 200? Because Richa has given a lot of mock test and given previous year question set of FMGE exams, and she found out that every time she is doing the exam, she is scoring between 180 to 200. So by solving multiple previous year paper, her range becomes small. How her range becomes small? By increasing sample size. When she observed so many of time, then she become precise. So remember that more significant data have a small confidence interval. And how the confidence interval is small? A small confidence interval is when there is large sample size. When Richa has done a lot of previous year paper, then she is sure that her marks will be there. But this first year, he have not done any previous year paper, so his range is big. And this data is a bullshit data, is a non-significant, useless data. Okay, this is very important area to remember. 2 point you should keep in mind. Now, let's come back to the question. You can see here that in this pink curve, sample size is maximum 1000. And if sample size is this big, then the data become to the point accurate. So which will have least mistake? Least mistake will be 1. In case of curve 2, sample size is 800. So sample size is 800, that's why the mistake is there. The mistake is more than 1. So more mistake, margin of error will be more in 2. And margin of error will be maximum in 3. If less sample size, margin of error will be more. Okay, and it's a very simple thing. Now, let's say, suppose you are weak in any subject. Suppose you are weak in pathology. How can you decrease your margin of error? To decrease your margin of error, just make a rule that I will solve at least 25 questions of pathology per day from this day till my exam. If you made this rule that I will solve 25 PYQ per day from that subject which is weak, patho, let's say. So by doing PYQ of patho 25 each day, by the time of exam, there is 20 days still there. So by that 20 day, your patho will become strong. Na? How you decrease the error in patho? By increasing sample size. So the more sample size, less is the error. And this is actually the way. I have talked with some student who said that, sir, this subject is not done, this subject is weak. I said, bro, this is just 1 or 2 subject you are talking about. You should be happy that your 14 or 15 subject is complete. Rather than looking at 3 subject which is not done, look at the 15 subject which is done and appreciate yourself. Don't forget to appreciate yourself that yes, I have done hard work. And now about those 3 subjects, don't worry. Just do PYQ of those 3 subjects and read topic also, not just question. So if you will do 10 or 25 PYQ of those 3 subjects in remaining 20 days, those 3 subjects will also be done. So don't be scared. Just keep on progressing every day, and any hard thing is hard first time. Second time it become easy. And you know what? It applies to most of the thing. Okay. Chalo. So let's move ahead. सैफ अली खान इज आस्किंग द क्वेश्चन कि सर आप कह रहे थे 180 लगाओ तो 150 मिलेगा, ये कौन सा एरर है? वो एरर नहीं है, वो जीएसटी है जो सरकार काट ले रही है. It has been usually found that a student who are scoring around 170 in guest paper and all, they get less than 150 sometime because it's like the GST is being deducted from their marks. So that's why my request is always target 180. In that way you are not at the borderline, you are safe. And if you keep progressing every day and have a command over the PYQ topic, you can easily get it. Just focus on day work. Don't focus on exam. Focus today, target of 100 PYQ day. Do 100 PYQ in the morning. Because in the morning you are fresh-minded, and in exam also in the morning you have to do PYQ. So do 100 PYQ each morning from this day till exam. By doing those PYQ in the morning, you will be sure that which topic are weak, which area I need to study, and then study those area in the day. If you keep doing it for remaining 20 days, I am sure you will definitely pass. But be consistent. Don't just read theory. I have seen students, they are scared of doing PYQ. Because when you do PYQ and you are wrong, your ego get hurted. So it's a defense mechanism by which we save ourselves from ourselves. अपनी फट जाती है जब मार्क्स कम आते हैं और हम अपने नज़र में नहीं गिरना चाहते हैं, इसलिए हम PYQ बनाना ही छोड़ देते हैं और केवल थ्योरी पढ़ते रहते हैं. ये बहुत गलत अप्रोच है. अपनी फाड़ोगे तभी तो रियल एग्जाम का प्रैक्टिस होगा ना. जीत याद रखना, डर के आगे ही जीत है. डेली मेक 100 PYQ at least, and then based on those PYQ analysis, read the theory and you have much higher probability of getting good marks. Okay? बाकी आप सब जानते हो, आप खुद भी समझदार हो. बस PYQ से डरना नहीं. और रोज 100 बनाने का एक वो कर लो अखंड एकदम, और होगा, है ना. सम ऑफ योर सीनियर विल से कि PYQ क्वेश्चन आर नॉट कमिंग दिस डे, दे आर बुल सिटिंग यू. As I said in my last 100 question, guess 100 question, 14 question came. What was those 100 question? There were only PYQ. What are these questions? They are only PYQ. So if PYQ are not being asked, how come 14 question came from those 100? And PYQ do come. In July it come less, in December it come more. So never ignore PYQ. And along with doing FMGE 3-4 year, or 3-4 year or 5 year, whatever you can do, please do 3 year of NEET at least 3-4 year of NEET also, because they are very interrelated. Okay, chalo. Now let's move ahead. Which of the following is a heat sensitive indicator of vaccine viability? I hope you can answer. Please do answer. You all have seen it. If in the box the circle is here and it is same color, will you use this vaccine or will you reject it? Same color, what you do? Accept or reject? Because one thing is it can be light. Second thing is it can be comparatively light. Third thing, same color. So same color, what do you do? We will use the first two which have lighter circle, and we will reject the third one. If it is same color or if it is darker, then we definitely reject both of these. Okay, and this is known as VVM, vaccine vol monitor, which tell us whether the temperature was properly kept or not. Okay, now yes, very good, we will reject it. Correct, Vikas and a lot of other friends, all of you are right. Let's come to the next question. Which of the following is set up for health planning at the village level? Health planning at village level. What will you do it? Who do it? Health planning at village level. Answer is VHSNC, Village Health. This I should have asked from you. Village Health Sanitation Nutrition Committee. These are team of 5 people in the village, and they prepare village health plan. They also prepare village action plan. In village health plan, ASA worker help them. In village action plan, Panchayat people help them. And the other work of VHSNC is that along with ASA and Anganwadi, they celebrate Village Nutrition Day. Village Nutrition Day is known as Mamta Divas. And कहाँ पे ममता दिवस ज़्यादा मनाया जाता है? बताओ. Which state we have Mamta Divas is celebrated most? It should be in West Bengal, Mamta Banerjee. But the answer is Gujarat rural part, they celebrate Mamta Divas most. Okay? देख रहे हो ना, मोदी मना रहा है ममता दिवस. There is love in the air. आएगा न्यूज़ तुम्हें भी देखना. तो याद रखना, विलेज न्यूट्रिशन डे हम महीने में एक बार मनाते हैं, once in a month. And Village Health Sanitation Nutrition Committee work for that. Okay? चलो, next question. This is the national immunization schedule, and there is a child who came at 13 months, and there is not any immunization in the past in this kid. So what vaccine will you give? Can you answer this question? Try to get the answer if you know it. Can you answer it? This is, to answer this question, you should remember one point, important point, that rotavirus, if you can answer it, I am waiting for your reply. Rotavirus, rotavirus IPV, fractioned IPV, not fucked IPV, fractioned IPV, then BCG and pentavalent. These 4 vaccines are not given after 1 year. They are given only up to 1 year. So after 1 year, we will not give any of these 4 vaccines, and answer will be clear. But in case of rotavirus, there is one extra thing which I want to tell. The first dose of rotavirus should be given before 15 weeks of life. And the second dose of rotavirus should be given before 24 weeks. Okay? So, these 4 are not given after 1 year. One last information I want to give you is that DPT is given up to 7 years. After 7 years, we cannot give DPT because DPT has pertussis, which can cause convulsion, unconsolable cry, or fever. So due to pertussis, we are not giving DPT after 7 years. Now let's see the answer. Of course, BCG we cannot give, so option 1 is ruled out. OPV we cannot give, so option 2 is ruled out. BCG, OPV we can't give. But it is not OPV, it is OPV first dose because it is coming for the first time, so first dose. So the correct answer will be, see, in the case of option number B, if you look at option number B, they are writing pentavalent, and pentavalent we cannot give after 1 year. So BCG, penta, BCG, these three are ruled out. In option D, we have OPV, first dose, DPT, and measles. All these three we can give after 1 year. So correct answer will be D. Very good, Nida Ansari, Prince Yadav, JV, Mans. Manaswini and Dr. Sarip, all of you are right. And Dr. Power of Siva is also right. Very good. Dr. Power of Siva was writing Ghodi in the last comment. I don't know why Ghodi. Siva, Siva, getting naughty. Come here. Next question. They have given a graph here. It's a box and whisker plot. And they are asking, which is correct statement? Okay. There are two questions on mean, median, mode. One question came in last FMGE exam, which we will come here, which we will discuss. But this question is based on positive and negative skewed curve and all. And what is this box and whisker plot? This is the box. It starts from 25% to 75%. And this is the whisker or tail. And box and whisker plot is used to identify outlier. Identify outlier. Let's understand what does it mean, outlier. There is a survey in UK, which they do almost every 2-3 years, that how many sexual partner you have in your life. So the usual answer which UK people gave was 2 to 7 partner. But in the same UK population, some people, they answered 488, 599, 699. So if you include those hunter data in the normal people data, the average normal of UK population will also go very high. So these are those data. They are outlier, very high data. And those data which are very high, like 699, 788, all those people, they are outlier. So in box and whisker plot, we remove those outlier. That is the use of box and whisker plot. Okay, do remember it. Now, here they are drawing a box and whisker plot, and they are asking, is it a positive skewed curve or negative skewed curve? So, if you draw a curve here, the straight part is like this, and this part will be skewed. Between 40 to 75, this is the skewed part. Skewed का मतलब होता है खिंचा हुआ, टेढ़ा, लंबा. तो skewed part is between 40 to 75. And 40 to 75 are bigger number or smaller number? As compared to 25 to 40, 40 to 75 are big number, na? So skewed part is towards bigger number. और अगर आप आपके लाइफ में बड़े नंबर की ओर जा रहे हो, if your marks are increasing, your money is increasing, are you skewing positively in life or negative? Of course, you are also skewed positive. So skewed part towards bigger number, that's why it is positive skewed curve. And remember one line here, that in positive skewed curve, mean is greatest. क्या बड़ा होता है? Mean is greatest. What does it mean, mean is greatest? See, remember, median बीच का है. Median always remain in center. So if you remember this line that mean is greatest in positive skewed curve, तो पहला हो जाएगा mean. बीच का कौन है हमेशा? मीडियन. तो मीडियन बीच का. और आखिरी हो जाएगा मोड. और करेक्ट आंसर होगा ऑप्शन ए, मीन मीडियन मोड, क्योंकि यह है पॉजिटिव स्क्यूड कर्व. लेकिन इसी लाइन के हेल्प से हम दूसरा पार्ट भी याद कर सकते हैं. सी, इफ यू रिमेंबर दैट मीन इज ग्रेटेस्ट इन पॉजिटिव स्क्यूड, इन नेगेटिव स्क्यूड विच वन विल बी ग्रेटेस्ट? मीन इज ग्रेटेस्ट इन पॉजिटिव, मीडियन कैन नेवर बिकम ग्रेटेस्ट. सो मोड विल बी ग्रेटर इन नेगेटिव स्क्यूड कर्व. सो व्हाट विल बी द सीक्वेंस इन नेगेटिव? मोड, फिर मीडियन, फिर मीन. This is the sequence for negative skewed curve. But you need not to remember this. Just remember one line, कि positive skewed curve में mean is greatest in positive skewed curve. That's it. Okay, and you will remember the sequence mean, median, mode in positive skewed curve. That's why the answer is A. Now, sometimes it becomes confusing which one is positive skewed curve, which one is negative skewed curve. And to help you there was a student friend in Jaipur. He told me a very good golden rule to remember it forever. He say, take this bar as penis, thought of sex. Danda ko samajh lo, danda. Now, when this penis or thought of sex is below the belt, under our control, then we focus more on study. And we get good marks, we move positive in life. So when the penis is under control, that is positive skewed curve. But when the penis or thought of sex is in our mind all the time, then we do not focus on study and our marks go down. That is negative skewed curve. So negative skewed curve has danda in the head, bar above and bar below is positive skewed curve. Okay, I hope you will remember it. So now let's move ahead to the next question. But before going to the next question, there is a common question which they are asking these days. Let me ask it here. Question is that if suppose there are this number 2, 6, 4, 18, and first they will ask question number 1, which one is better measure of central tendency? How will you measure central tendency? Is it mean which is better, or is it median which will be better here, or mode will be better here? Out of mean, median, mode, which one will be better? So remember my friend, if there is a very large number, mean is mean minded, mean छोटी सोच का है. Wherever mean get big number, mean get deviated towards it. So in all these cases, if there is big number, we cannot use mean, then median is better. Okay, if there is big number, median is better. Second question which they asked in last FMGE exam from this was that if 18 is replaced by 8, suppose 18 is wrongly written in place of 8 and 18 is replaced by 8, then which one is most affected? सबसे ज्यादा असर किस पर पड़ेगा? Most affected will be which number? Option A, will it be mean which will be most affected, median which will be most affected, or mode will which will be most affected? किस पे सबसे ज्यादा असर पड़ेगा? अगर हम 18 की जगह 8 लिख दे तो try to give the answer. Very good. Nikhil Agarwal and Hars Rawat and Prince Yadav, Mansanvi, Riya, Dr. Amit Anand, they all have given the answer. If we replace 18 with 8, most affected will be mean. Mean will be most affected. See it. When it is 2, 4, 6, 18, what will be the median? Median कोई बीच का नंबर नहीं है, तो average of middle two number become median. 4 plus 6 by 2 यानी 10 by 2, 5. 5 is median. And if I replace 2, 4, 6, 18 by 2, 4, 6, 8, again middle two number is 4, 6, so again median will be 5. So median does not get affected by large number. Mean get affected. Here mean will be 5. Average निकाल के देख लो 5 ही आएगा. And here when it is 2, 4, 6 and 18, if you find mean will be 18 plus 2, 20 plus 10, 30 by 4. So 30 by 4 will be 7.5. So 7.5 was the mean when it was 18 and 5 is the mean when it become 8. So which one is most affected? Mean पे सबसे ज़्यादा असर पड़ेगा बड़े नंबर को बदलने का. Okay, very good. Next question. In a randomized controlled trial, patient with direct inguinal hernia, someone like me, and it is being compared with a new surgery A and the gold standard surgery B. P value of the trial is 0.04. What can we conclude from this? देखते हैं ये आंसर आपको पता है कि नहीं, सोचिए. In this question they are just want to ask what is the meaning of p value. कौन सी लाइन p value के बारे में सही बता रही है? प्लीज देखिए और आंसर दीजिए. मैं पानी पीता हूं. बताइए. देखो एग्जाम का टाइम है, ज्यादा डिटेल में नहीं जाऊंगा, फोकस करो. p value simply meaning false positive. p वैल्यू का डिफिनेशन है प्रोबेबिलिटी ऑफ गेटिंग सिग्निफिकेंट रिजल्ट बाय चांस. वो भी लिख देता हूं. सिग्निफिकेंट रिजल्ट तुक्के से, सिग्निफिकेंट रिजल्ट बाय चांस इज p वैल्यू. फॉल्स पॉजिटिव इज p वैल्यू. इसका सबसे अच्छा एग्जांपल है दिस कोरोनिल मेडिसिन. कोरोनिल ड्रग ट्रायल was done on patient who were without fever, and then Baba Ramdev and their researcher, they said कि it can treat fever. So if the trial is done on people without fever, how can it treat fever? So that means they were getting a significant result, but just by chance, by mistake, they were falsely positive about coronal drug. फेक डाला, झूठ बोला, है ना? That is p value, and p value have the same meaning as alpha error. इन दोनों का मीनिंग सेम होता है, सेम मीनिंग. अल्फा एरर का भी मतलब होता है फेंकना, ओवर एस्टिमेट करना, ओवर एस्टिमेशन, ओवर एस्टिमेशन, और सेइंग नॉन सिग्निफिकेंट एज सिग्निफिकेंट. बेकार की चीज को काम का बोलना, सेइंग नॉन सिग्निफिकेंट एज सिग्निफिकेंट. देखो आपके भी बैच में कोई एक ऐसा दोस्त होगा आपका या कोई सीनियर होगा जो लाइब्रेरी में घुसता है और निकल के बोलता है यार वो लड़की भी मुझे देख रही थी, वो भी देख रही थी, वो भी मेरे प्यार में गिरी हुई है. तो वो सारे के सारे वो कैसे लोग हैं? वो अल्फा एरर कर रहे हैं, वो ओवर एस्टिमेट कर रहे हैं. गर्ल्स आर जस्ट लुकिंग कैजुअली, नॉन सिग्निफिकेंटली, एंड दे थिंक इट इज सिग्निफिकेंट. दे आर गेटिंग सिग्निफिकेंट रिजल्ट बाय चांस, बाय लुक. बंदी ने देखा, बाय चांस देखा, और उनको लगा कि सिग्निफिकेंट हो गया. दैट इज पी वैल्यू, दैट इज अल्फा एरर. और बाबा रामदेव भी क्या कर रहे थे? नॉन सिग्निफिकेंट कोरोनिल को सिग्निफिकेंट बोल रहे थे. सो रिमेंबर दिस पॉइंट, p value is same as alpha error, both means false positive. And in this 4 line, if you see line D is saying probability of false positive report, that operation A is better than B is 4%. So wherever false positive is written, that is alpha error, that is p value, and that is the answer. Now type 2 error का मतलब होता है beta error. Beta error is just opposite of alpha error. Beta error का मतलब होता है खुद को अंडर एस्टिमेट करना, अंडर एस्टिमेशन. और अंडर एस्टिमेशन को कह सकते हैं फॉल्स निगेटिव, फॉल्स निगेटिव. ठीक है? जैसे कुछ आपके दोस्त रहते होंगे जो बोलेंगे मुझे कोई प्यार नहीं करता, मुझे कोई नहीं देखता देखती. दे आर डूइंग बीटा एरर, दे आर अंडर एस्टिमेटिंग देमसेल्फ. एटलीस्ट देयर फैमिली मेंबर लव देम फॉर श्योर, एंड दे नेवर नो, पीपल आर लविंग देम बट दे विल नॉट टेल यू, है ना? सो यू शुड बी होपफुल. फॉल्स निगेटिव मीन्स you are underestimating the result. False negative means miss out. Miss out is beta error, type 2 error. Okay? एक और चीज जान लो, last point, that अगर p value is less than or equal to 0.05, p value क्या है? Mistake है, that's an error, and error should always be minimum. तो अगर आप किसी भी एग्जाम में जाते हो और 5% से कम क्वेश्चन गलत करते हो तो आप वो एग्जाम पास कर जाओगे ना, सिग्निफिकेंट हो जाएगा. So same story apply here. Whenever p value is less than or equal to 0.05, or you do less than 5% mistake in any exam, then we say that exam, that result is significant. Okay? That result is significant. And whenever result is significant, there is a null hypothesis which we created in the beginning, and we said that our medicine, our drug is useless. That null hypothesis is rejected. Okay? Do not forget this line. This is a very important line. Being asked in FMGE exam 2 times. जब भी p वैल्यू 5% से कम या उसके बराबर होगा तो गलती इतनी कम हुई है कि एग्जाम रिजल्ट सिग्निफिकेंट होगा और नल हाइपोथेसिस रिजेक्ट होगा. ऑलवेज रिमेंबर, p वैल्यू लेस देन और इक्वल टू 0.05, null hypothesis which say that drug is useless is rejected, and drug or study is significant. Okay dear, if you have any doubt feel free to ask the question. Very good. Come here. डॉक्टर शिवा, पावर ऑफ शिवा कह रहा है कि शिल्पा को देखने के लिए दोनों आंखें खुल जाती है रामदेव बाबा की. ये शिल्पा कौन है यार? तो शिवा, पावर ऑफ शिवा को थर्ड आई खुली हुई है, ये अलग बात बता रहा है. कम हियर, कम बैक. सी, a large number of tests were done in series. So if you are doing test in series, which will be true? That they ask. Test in series का एक बड़ा अच्छा एग्जांपल है HIV. पहले करते हैं इलाइजा, फिर करते हैं वेस्टर्न ब्लॉट. ओके? और टेस्ट इन सीरीज मींस वन आफ्टर अनदर वी डू two or more than 2 टेस्ट, एंड अगर दोनों में पॉजिटिव आया, ओनली इफ बोथ द टेस्ट रिजल्ट आर पॉजिटिव, ओनली देन वी कॉल हिम एज ट्रू पॉजिटिव और डिजीज. और व्हाट इज सेंसिटिविटी? जैसे कहते हैं ना, सेंसिटिव बंदा है, सेंसिटिव बंदी है, मतलब वो दूसरे के दुखों को अपने जीवन में इंक्लूड कर रहा है. सेंसिटिविटी इज एबिलिटी टू इंक्लूड. The more people include, the more people came positive, the more sensitive test become. Okay? So sensitivity is, remember, ability to include. The more people you will include, more sensitive the test will become. और specificity क्या है? Specificity is ability to exclude. निकाल के बाहर करना. जितना निकाल के बाहर करोगे उतना स्पेसिफिक हो. Like I asked this question in class also, that will you give your shoulder to cry for both boy and girl? Let's say some boy or girl have breakup. Will you give your shoulder to both boy and girl, or will you give your shoulder only to girl to cry, or only to boy to cry? So if you are giving your shoulder to both boy and girl to cry, it means you are sensitive, because you are including both boy and girl in your helping zone. But if you are giving your shoulder only to girl, that means you are excluding all other girls and boys. So you are specific. Specific is exclusion. And we should also remember their formula, which is very important and easy to remember. 2 times they have just asked you to remember the formula, which is so simple to remember. See, when they write sensitivity, sensitivity is true positive, and in the denominator there is true positive and just opposite of that. What is opposite of true? False. What is opposite of positive? Negative. So formula of sensitivity, you just have to remember true positive. ट्रू पॉजिटिव हो गया याद. अब नीचे देखो, ट्रू पॉजिटिव एंड जस्ट अपोजिट ऑफ दैट. सो फॉल्स नेगेटिव, ट्रू का अपोजिट फॉल्स, पॉजिटिव का नेगेटिव. सो ट्रू पॉजिटिव बाय ट्रू पॉजिटिव प्लस फॉल्स नेगेटिव, दैट इज सेंसिटिविटी. एंड व्हाट इज स्पेसिफिसिटी? स्पेसिफिसिटी इज ट्रू नेगेटिव. आपको बस याद रखना है, ट्रू नेगेटिव एंड अगेन इन द सेम वे जस्ट अपोजिट ऑफ दैट. व्हाट इज अपोजिट ऑफ ट्रू? फॉल्स. अपोजिट ऑफ नेगेटिव? पॉजिटिव. सो फॉर्मूला ऑफ स्पेसिफिसिटी इज ट्रू नेगेटिव बाय ट्रू नेगेटिव एंड फॉल्स पॉजिटिव. दैट्स इट. नाउ हियर सपोज मैं गया पार्टी करने 100 सेक्स वर्कर के साथ, नहीं 99 सेक्स वर्कर के साथ. आई वेंट फॉर ए पार्टी विथ 99 सेक्स वर्कर एंड देन ऑल 100 ऑफ वेंट फॉर Eliza, and in that Eliza 20 came positive. Guess where will be this man? In the positive part. Now all these 20 people, they went for confirmatory Western blot, and finally only 5 came positive. Guess where am I? In this positive part. So these 5 positive are actually having the disease. They are true positive. But what about the 15 people who are left in between? यहां 20 लोग थे और फाइनली 5 पहुंचे, तो 15 लोगों को निकाल के बाहर कर दिया गया ना. These 15 people, they wrongly came positive on Eliza. They were false positive, and this 15 false positive were removed. These are removed by test in series. And whenever you are removing people, excluding people, your specificity will increase. So specificity will increase. But when you are removing people, it means you are including less people. So sensitivity will decrease. So correct answer is definitely option B. Do remember this point, that whenever we do test in series, remove people. So because it removes people, sensitivity decreases. Because it removes people, test in series. So sensitivity decrease. And when sensitivity decrease, specificity is just opposite of that. So specificity will, sensitivity will decrease, so specificity will increase. Because we are removing people, so specificity will increase. And if test in series is decreasing sensitivity, test in parallel will increase sensitivity. Okay? So just remember this one line, test in series, remove people, so it decreases sensitivity. Okay, next question. Phase 1 of clinical trial is done for. Can you give the answer? What is the answer? Safety, efficacy, short-term side effect, long-term side effect. Short-term side effect, long-term side effect. This is the mnemonic which they use sometime to remember it. So phase 1 say definitely safety. Then phase 2 say efficacy. Phase 3 say short-term side effect. And phase 4 is the post-marketing surveillance. They keep asking this question. Post-marketing surveillance. And this post-marketing surveillance, it tell about long-term side effect. Okay. So these are the 4 phases. CES can be the mnemonic. And in phase 3, usually we do RCT and all is done in phase 3, usually. Okay. Sure. Now, next question. Acha, one more thing. If you are looking in any vaccine trial or drug trial data, which information is most important? Most important ये है कि कितने लोग टपक गए, कितने मर गए, कितने बचे. Efficacy, effectiveness वैक्सीन के लिए important नहीं है. Most important thing is, most important data is survival data or death data. Survival or death data is most important in case of clinical trial. बहुत गर्मी हो रही है, मुझे अपने कपड़े खोलने शुरू करने पड़ेंगे. खोल ही देता हूँ. Okay. चलो come here. Next question. A child was brought to you with complaint of fever, malaise, and race, and the child was diagnosed with measles. What is the recommended period of isolation? So, from onset of rash till 5 days after rash, we will isolate the patient. Okay? This is the isolation period for measles. A very similar question on chicken pox came in NEET exam just 1 year back. Remember, if we are doing isolation for chicken pox, it is 6 days. And the treatment which we give here is varicella zoster immunoglobulin. But this varicella zoster immunoglobulin is written in PARC should be given within 72 hours, not 48 hours, 72 hours. But who will get this varicella zoster immunoglobulin? This varicella zoster immunoglobulin is not useful in adult male because it is not, adult male do not develop severe complications and all. They do not die due to varicella zoster. So it is given within 72 hours, not to adult male. Okay? So they had given this question that in a boy hostel, chicken pox case occur, isolate for 6 days, but don't give varicella zoster immunoglobulin to everyone. Second point, in my home, actually, there is a mother, old age, and there is a pregnant lady. There was a pregnant lady. Now, I just became father 8 days back. My second child came. But suppose I had a pregnant lady in the house, mother, and a child, less than 1 month. So, which should be given first preference for giving varicella zoster immunoglobulin? Kiski sunu? Maa ki sunu ki wife ki sunu? Kiski sunu? Batao. In this case, wife ki suno. First preference is pregnant lady. Because there can be congenital anomalies. Second preference is old age and less than 1 month child. Okay, so do remember these points. Next question. BCG vaccine provide protection against which of the following? It do provide protection against pulmonary TB. It do not protect against CNS TB or disseminated TB. Okay, these two are not being protected by BCG. BCG protects from pulmonary TB and it can protect from skeletal TB also. So the better answer will be answer D. Pulmonary and skeletal TB are the two things which is prevented by BCG. Now, what is the dose of BCG that we give? Is it 0.1 ml? No, it is 0.05 ml. Till 1 month, it is 0.05 ml. And what is the diluent of BCG? They have asked. Diluent is normal saline. There is two more things for which we know the diluent. Diluent for MR and diluent for JE. For MR, diluent is sterile water. And for JE, diluent is phosphate buffer solution. Phosphate buffer solution. कैसे याद रखोगे? See, as soon as the child is born, we give BCG. पैदा होते ही हम बच्चे की जिंदगी थोड़ी नमकीन बनाना चाहते हैं, and we give normal saline just after birth. Now, M for MR, M is also for mother love. And mother love is just like sterile water, na? So M for MR, M for mother love, sterile water. And if you write Japanese, in Japanese P will come. So JE, phosphate buffer solution. Okay? I hope you will not forget. Next question. In a community, there are usually 40 to 50 reported cases of dengue every week. And this week, 48 reported cases occurred. So the expectation is 40 to 50. And our result is coming within the expectation. If it is within the expectation, we call it endemic. Okay? Endemic within expectation. If suppose in case of 48, if they have written 5,000 cases, that is much more than expectation and we call it epidemic. Sporadic means no fixed pattern of case. Anything can occur. And sporadic pattern is represented by Poisson distribution, which represent distribution of random event with time. Okay? So you do, within how many time we have to report the outbreak? Outbreak should be reported within 24 hours. To PHC. Two more question here. Where will you report the death of a mother or an infant? Where will you report the birth rate, IMR or MMR? Not IMR, MMR. IMR, MMR is detected by doing survey. My question is, where will you report birth and death? Will you report it at subcenter, PHC, CHC? Where? Birth and death reported at PHC. Marriage register. Where is marriage register? That is at subcenter. Subcenter, marriage register. PHC, birth and death. And within how many days you have to report birth and death? Within 21 days. You have to report it. Now, one more question from here is, what is the definition of an index case and primary case? So, I think you all know, primary means first case. And index means first case coming to hospital or reported to health system. Coming to health system contact. Okay? Let me explain it with an example. For example, it's a real story. I was in China in December 2019. I came back to India in around 24th of December. And then my brother brought me the luggage, and I just took the flight to Kerala, and I went to take class in Kerala. And from Kerala, first case of corona was reported in India on 31st of December 2019. So in this story, who is that Kerala guy who was reported to health system? Was it a primary case or index case? Kerala guy came to health system. That Kerala student was index case. But I was the primary case who brought corona from China. Yes. Ghamand nahi kiya kabhi, hai na? But I brought it. So primary is the one who was infected first. If suppose they would have caught me at Delhi airport, I would have become index case. So primary can be index. But at that time in Delhi, they were just measuring कि किसी का लाल तो नहीं आ रहा है ना, गर्म होना है, infrared ray से लाल तो नहीं आ रहा है, वो देख रहे थे. They were not doing RT-PCR. So primary case is first case, reported or unreported. Index is reported first case. So Kerala guy was index, I was primary. Next question. Which of the following vaccine has not been introduced to the immunization program in India? In immunization program, influenza vaccine is not included there. Okay. Now, Japanese encephalitis is given in children. There is a trick here. There is a trick. See, in the national program, I also got trapped here. In the national program, there is this vaccine Hib. If you look at the pentavalent vaccine, pentavalent have these 5. One is Hib. Hib stand for Haemophilus influenza type B. And then there is hepatitis B and DPT. So Haemophilus influenza type B is included in the national schedule. But adult Japanese encephalitis is not included. JE is there, but JE is not for adult. We give JE at 9 month and 16 to 24 month. 2 doses we give. 9 month and 16 to 24 month. But in case of endemic area like Gorakhpur district of UP, JE can be given to adult. So adult JE only in endemic areas, not national wide. Okay, that's why the correct answer will be A. And they have asked this question. What is the route of giving JE? Is it IM, ID, SC, intranasal? Can you answer it? I'm waiting for it. This is a very good question, and I hope you should remember it. Yes, Virender Singh, you are right. Adult JE is not given. CHS is asking, send the link of previous class. I will send it in that chat box. Plus, it is just simple. 100 sawal be misal if you will type. The older one will come with some 16,000 view and all, and you can see it. Come here. Now, what is the route of JE? So the route of JE is subcutaneous. Subcutaneous is JE plus MMR. 2 vaccines are given subcutaneous. Now, which one is right? Which one is left? MMR is right leg and JE is left leg. Then, intranasal they can ask. Intranasal drop is only one vaccine given intranasal, that is influenza. Influenza live vaccine is given intranasal. Along with that, Government of India has recently Covax, in place of Covaxin, they have used Incovac. And then there is Zydus Cadila DNA vaccine. These all, COVID vaccine can also be given by nasal droop. Intradermal is FIPV and BCG. Of course, BCG is in left, so FIPV is in right deltoid. Okay? And oral is, of course, you all know rotavirus and polio. Rest all are given muscular, intramuscular. So it's simple to remember the route. Don't forget it. The life cycle of which of the following is depicted in the image below, and image did not came in the PPT. I should have checked it. So let's discuss all these things one by one. In JE, remember there are 3 things: ardid bird, then there is pig, and then there is human. So ardid bird, which is also known as heroin, is the reservoir. Can you tell me who is the maintenance host of JE? It's a challenge for all of you. Who is the maintenance host for Japanese encephalitis virus? Who is the maintenance host? Tell me. Manaswini is asking, does sir take classes for NEET also? Of course, dear. And I was taking classes in Bhatia for 3.5 years, and in Allen Next also, there is a NEET batch also. We will be taking classes there also. Come here, focus. Who is the maintenance host, if you can answer? Human is the dead end host. I hope you know. Dead end host because if Culex bite me and then bite some of my brother, it cannot transmit JE there. Pig is the amplifying host. है ना, मैं ऐसा सोचता था कि सुअरवा गाता होगा JE के लिए कि मैं तेरा एम्पलीफायर है ना, this is the amplifying host pig. Who is the maintenance host? 4 of my friend has answered pig and you all are wrong. Maintenance host is also ardid bird. And I know you will be wrong, and there is nothing wrong in the class. In class, nothing is wrong. And you just learned one new thing. Maintenance host or reservoir means when there is non-rainy season, then virus is stored in the bird. So non-rainy season, they store it. That's why they are reservoir or maintenance host. Pig is amplifier and human is dead end host. And who is the transmitting agent? Of course, Culex. And Culex is also known as nuisance mosquito because it breed in dirty water. तो समझ रहे हो ना? क्यूलेक्सवा इतना टैलेंटेड है, पहले तो ये उड़ती चिड़ैया के बम में काट लेता है, फिर जाके सुअरवा के बम में काट लेता है, और फिर सुअर से गधवा के बम में काट लेता है. एंड दैट्स द लाइफ साइकिल. इन जिका वायरस लाइफ साइकिल they will have image of a date palm tree, okay, and along that date palm tree there will be some birds, fruit bat, and there can be pig also around that. So that will be Zika virus because Zika virus is, of course, origin is by fruit bat and it is transmitted by pig or date palm sap. Okay. In case of rabies, you all know the life cycle. Nipah life cycle start from fruit bat and then respiratory route is the transmission way. 2 more life cycle you have to remember. One is the life cycle of leptospirosis. Whenever they ask the life cycle of leptospirosis, there will be rat urine in that life cycle. Rat urine, cow urine, then to human. Then if they ask life cycle of brucellosis, brucellosis have a special type of cross, Maltese cross. Maltese cross will look like this. And this type of cross will be there. So Maltese cross will be there. And then they can ask the question from hydatid cyst. Hydatid cyst disease, dog is the host in which sexual life cycle occur. And what is the characteristic of adult? Adult do sex. So adult form is in dog and human are intermediate. Intermediate means asexual host are human. Okay, so these all life cycle go through in micro, of course. Next, come here. While collecting blood for sample, you have spilled some on the floor. So what will be the immediate next step? We should cover it with 1% sodium hypochlorite. This is for blood spill, whether HIV positive or negative. And after mopping, where will you throw the cotton which you have used? Of course, you will discard it in yellow category. And yellow is the one where we do incineration. So that will go there. Now, of course, there will be more question on that and we will come back to this topic of biomedical waste. Let's move ahead first. Which drug packet is there? This is the multiple drug therapy, MDT, for leprosy. Okay? And suppose I am a leprosy patient who developed lepra reaction while taking drug. They have asked this question recent exam that in lepra reaction, what is the drug of choice? Drug of choice is methylprednisolone. Now tell me, when I am taking this drug, methylprednisolone, should I stop my leprosy medicine or should I continue taking it? Answer is, don't stop leprosy medicine. Continue taking MDT, multiple drug therapy for leprosy, which is shown here. Okay? Next question. This symbol is of radiation hazard. Okay, this symbol. Midday meal program is no more in India. We have replaced the name of midday meal with PM portion. And mark my word, this is a question which is very likely to come in this exam. That what is the target of PM portion? Option A, reduce malnutrition by 2% each year. Reduce malnutrition by 3% each year. Reduce malnutrition by 6% each year. What is the answer? So the answer is PM portion is targeting on reducing malnutrition by 2%. If it is anemia mukt Bharat, they have asked it already. What is the target of anemia mukt Bharat? Anemia mukt Bharat will reduce anemia each year by 3%. Each year by 3%. Anemia, less anemia each year by 3%. Now, remember my friend, there is this program, this Poshan Abhiyan is a program. And under that Poshan Abhiyan, there are 5 programs which come under Poshan. First is PM Poshan. Second is Anemia Mukt Bharat. Third is nikchay portion. Nikchay. See, nik means no. Chay means loss of body. Okay. So nikchay means no TB. For no TB, the portion which is given is the money which is given is 500 rupees per month. This is the amount for nutritious food to TB patient. Third program. Fourth program under it is Anganwadi program. Fifth program under Poshan program is adolescent program. So 5 program come under Poshan. Okay. Now, in this midday meal or PM Poshan, we give which of the following ABCD? If you know the answer, please give the answer. Kushal Suman is saying A is coming. All of you are mostly saying A. Very good. Protein we give half. Calorie we give half, 1/3. Why? Because in the rural parts of most of the states, mother and children are only eating rice. Bhat kha rahe hain wo sab chawal. And rice will give them the calorie but not the protein which they need. So protein is more in midday meal, calorie is less because they need protein more. So protein is half, calorie is 1/3. Under which ministry PM Poshan come? It come under Ministry of Education. Okay. Smriti Irani is Education Minister. She is looking over it. Okay. Now, next question. What test is used to check for freeze damage to vaccine? That test is known as sake test. Take out the vaccine, sake it. And after saking anything, if you find precipitate, what will you do with precipitate? Throw it. If no precipitate, use it. Okay, so that is sake test. Now, one more thing I want to tell, of course, is open vial policy, a very common question. Which vaccine follow open vial policy, which do not? So open vial policy means after opening a vial, if it is stored adequately between 2 to 8 degrees Celsius and the vaccine vial monitor is intact, then we can use this vaccine till next 4 weeks of opening the vial. And which vaccine follow open vial policy? Very simple to remember. Hep B, PCV, all tetanus, all polio. Hep B, PCV, all tetanus, all polio. Say it and you will remember it. What are the vaccine? Hep B, pneumococcal conjugate vaccine, all tetanus, all polio. They follow open vial policy. What is all tetanus means? All tetanus means DT, TT, DPT, pentavalent. What is all polio means? OPV, IPV. Which one is Salk? Which one is Sabin? Shark is IPV because IPV is killed. Salk laga mar gaya. So Salk is killed, IPV. And OPV is Sabin. And there was a student, Pragya. She gave me this mnemonic. OPV is live na. So it is Sabin because it is live-in relationship. And Pragya was in live-in relationship in that class. So I remember that. She remembered that mnemonic. So live is Sabin, killed is Salk. Remember, these vaccine follow open vial policy. So if you have DPT and MR, both are opened. In the next schedule, will you throw MR or will you throw DPT? You will throw MR, but you will keep DPT because DPT follow open vial policy. Okay? Do remember it. Next question. This graph they have given because DPT follow open vial policy. Okay? Do remember it. Next question. This graph they have given and they have asked which out of these is true for this graph. So, if let's say here we have blue curve with 2, here it is 4, and here it is 6. 2, 4, 6 are 3 digit which are coming, suppose. Now the topmost point is the mode. Topmost point is mode. So there are 3 modes. First mode is 2, second mode is 4, third mode is 6. And we cannot take average of mode. So because we cannot take average of mode, mode will be 2, 4, 6 separate. And there will be nothing like combined mode. Because mode average can't be taken. Okay. Now, if you look at the mean and median, all these 3 are normal curve. And in a normal curve, you all know mean, median, mode all are at the center. So if you look at the mean, 2, 4, 6 are the 3 mean. And if you take average of 2, 4, 6, average of 2, 4, 6 will be 2, 4, 6 will be 10 plus 2, 12, 12 by 3, 4. So average mean is 4. And median is middle number. So out of 2, 4, 6, what is the middle number? 4. So average mean or average median are both 4. Average median and average mean are 4. But mode average cannot be taken. So mean and median will be equal, but they will not be equal to mode. Correct answer will be option B. Mean, median equal, not equal to mode. Okay. Now, next question. Okay, you have already done it, so just quickly. There are 2 groups and we are measuring BP. What is the answer? 2 group and we are measuring BP. Simple. BP is measurable. Answer will be unpaired t-test. If in place of 2 group, I made 3 group, What is the answer? ANOVA. If I say I am measuring BP before and after, answer will become pair t-test. And if I say I am measuring percentage of hypertensive patient of two group, so percentage of hypertensive patient of two group, percentage and hypertension both represent qualitative data, answer will be chi-square test. Okay. MMR, very important area of question, is best given as. Try to give answer to this question. It looks simple, but let me see whether you are right or wrong here. Dr. Suresh Patel is saying कि please explain कर दो sir. अरे why not Suresh bro? Whatever you say, your wish is my command. See my dear friend, we have discussed similar question in the past. That's why I was rushing through it, but it's okay. First thing you have to look is the data measurable or not measurable? Can you measure BP? Yes. So the data is measurable. It means answer can be out of A, B, C, anything. But if I say hypertension, क्या आप hypertension को नाप सकते हो? नहीं. आप hypertension को you can only classify hypertension into three category: mild, moderate, severe hypertension. ना ऐसा थोड़ी करोगे कि पेशेंट तेरे को 3.9 hypertension है ना? तो hypertension is categorical and percentage is also categorical. You cannot measure it. It's just quality है, category है. So if it is hypertension and data is in percentage, hypertension is qualitative, so answer will be chi-square. But because BP is measurable, quantitative, so answer cannot be chi-square. Chi-square तब होता जब hypertension दिया होता. Hypertension, then answer would be chi-square. Now, if it is 3 or more than 3 group, it is ANOVA. 3 or more than 3 group. If it is 2 group, it is unpaired. So here they have given 2 group, quantitative data unpaired. And if in the question pre, post, before, after, match, in 3 में से कोई भी word लिखा हुआ है, pre, post, before, after, match, then answer will be pair t-test. Because those 3 words are not written, so answer can never be pair t-test. Okay bro? क्या ये क्लियर हुआ? हाँ, सुरेश पटेल कह रहा है बहुत सारे न्यू लोग भी आए हैं. थैंक यू, शुक्रिया आने के लिए. आगे बढ़ते हैं वीडियो लोग. और yes, unmeasurable is chi-square. If you cannot measure it, just categorize it, that is chi-square. Correct. Next question. हाँ, maternal mortality ratio for a country is given. What is the best answer out of the 4? Can you give the answer? So definition of MMR is being asked 3 times. We should focus here. MMR means simply maternal death. Maternal death within how many days? Within 42 days of delivery. This is what they can ask. Within 6 weeks. 42 days of delivery, and they should die due to delivery related cause. Multiplied by 1 lakh, और 1 lakh में होता है 5 0, 10 to the power 5, divided by total live birth. ये फॉर्मूला जरूर याद रखना, बहुत बार पूछा हुआ है. Total live birth. And remember, maternal mortality is not a rate, it's a ratio. Why ratio? Because in ratio, numerator is not a part of denominator. माँ बच्चे से तो नहीं आ रही है, तो जब तक न्यूमरेटर डिनोमिनेटर से नहीं आएगा तब तक रेट नहीं होगा. बिकॉज मदर इज नॉट कमिंग फ्रॉम चाइल्ड, सो इट इज ए रेशियो नॉट ए रेट. ओके, एंड इट इज 1 लाख. सो विच आंसर विल बी करेक्ट? ऑप्शन सी, मैटरनल डेथ पर 1 लाख. ओके, अब इसी में हमें सस्टेनेबल डेवलपमेंट गोल के टारगेट याद होने चाहिए, विच केम इन लास्ट FMGE एग्जाम. सो इन SDG, MMR शुड बी लेस देन और इक्वल टू 70 पर लाख. 70 12 25, ये 3 नंबर बस आपको याद रखना है. 70 12 25. 70 MMR, 12 है नियोनैटल मोर्टालिटी रेट, लेस देन 28 डे से पहले जो मरते हैं. नियोनैटल मोर्टालिटी रेट लेस देन 12 पर 1000, एंड अंडर 5 मोर्टालिटी रेट लेस देन 25 पर 1000. क्या याद रखोगे? 70 12 25. ओके, अपार्ट फ्रॉम दैट, प्री मैच्योर कार्डियोवैस्कुलर डेथ शुड बी 1/3, and TB, malaria, HIV, all should be eliminated. This was the target for 2030. है ना? फ्री की दारू बट रही थी, लास्ट में पार्टी इंड हो रही थी, तो किसी ने बोला सर HIV, बोला इलिमिनेट, मलेरिया इलिमिनेट, TB इलिमिनेट, 2030 तक सब इलिमिनेट कर दो, और प्री मैच्योर कार्डियोवैस्कुलर डेथ को 1/3 कर दो. और एक लास्ट टारगेट दिया कि रिड्यूस एक्सीडेंटल डेथ टू हाफ. एक्सीडेंटल डेथ को हाफ करना है बाय 2020. और 2020 में कोरोना आया, एंड एक्चुअली एक्सीडेंटल डेथ बिकम हाफ. सो देन दे सेड कि देखा, बोला था ना कर लेंगे, तुम बोल रहे थे कि फेंक रहे हैं, हो गया ना. सो रिमेंबर दिस एज ए वे Only one target was achieved, only for 1 month. Accidental death half. Rest all is just in air. But remember the 3 number? 70, 12, 25. 70, 12, 25. MMR, NMR, under 5 mortality rate. Okay. What is this spike protocol? What is that? Spike protocol is, do you know the answer? Try to give the answer if you know it. Very good. What is this for? Spike protocol. There is multiple things which we use, like one is for counseling of patient, especially for family planning. Here we use gather approach. Greet, then ask what is needed, then tell the patient what are the options, help the patient in choosing one of the contraceptive, then explain the patient what are the side effects, and then ask for comeback review after taking that whatever contraceptive. So gather approach is counseling for family planning. Okay. Similarly, along with gather, there is one more approach, cafeteria approach. Cafeteria approach means just like if you go to CCD or somewhere, they will give you all the option of coffee and you choose from them. Similarly, in family planning, you have to give all the option to the patient and they will choose from it. So cafeteria and gather, these are for counseling of family planning. And spike protocol is for breaking bad news, like news of death or news of cancer to the people, to the patient. And very good, a lot of you were right. Vikas Raj, Omniscient, Tripod Doctor, Subhas Kumar, Narinder, Sivendra Singh Rajput, all of you are right. SK is saying, love you, sir. Love you, SK, bro. Let's move ahead. Next question. According to WHO Mental Health Gap Action Program, which of the following is not included in Mental Health Care Act 2017? So in Mental Health Care Act 2017, first of all, they made suicide as a non-criminal offense. Okay, suicide is not punishable. Previously it was punishable, not anymore. Second thing they did was no shock therapy, electric shock therapy, no tying of patient and all. No tying of patient and all. Mainly they asked this year also, when this Mental Health Care Act was given, 2017. So, which is not included in Mental Health Care Act? Of course, the social support thing they will always try to bring. The mobilization of resources is something which is done in every program. We use the resources available to make it happen. Interpersonal therapy is also given. Screening of family member is something which is not needed and not being done. Now, again, there is some debate in this part, but these two things can be the answer, interpersonal and screening of family member. But I think better answer will be A. And in psychiatry, we can go more detail into this Healthcare Act and we can come with that, okay? Now, a POSCO Act. POXO Act. POXO is what? Prevention of child from atrocities and some atrocities or some punishment to the child and all. So POSCO Act is for which of the following? It is not related with women empowerment or human trafficking. POSCO Act, like let's say a adolescent which is of 16 year or 14 year does a rape, then according to POSCO Act, he will get some relief. Because child, if he is adolescent and all, he should get some relief like that. So that is POSCO Act, which mostly deal with juvenile delinquency. Child sexual abuse is also something which is there, which also punishable under POSCO Act. What is juvenile delinquency? Juvenile delinquency means juvenile are those which are adolescent. Delinquent means they are not following the society norm. They are going away from the society. They are going things which are different than expected. So for juvenile delinquency, we can use it. For child sexual abuse also, we can use it. Now, out of these two, the better answer will be child sexual abuse, because if someone is doing child sexual abuse, POSCO Act will be applicable on it. For example, in the recent controversy, when all the wrestlers were protesting against that BJP MP, I don't know the name, and recently the wrestler said, I will not play for India for that also. So in that allegation, there was also a girl child who was less than 17 years, and she also said something wrong about that BJP person. So the POSCO Act came in use, and it was a strong thing. Now the POSCO Act is there, it's an unbailable warrant against that minister. So first thing that the minister did or that happened was that the girl took it back. That juvenile child took that allegation back. So then he was survived. So main thing is child sexual abuse. Why not juvenile delinquency? Because juvenile delinquency can be anything. If someone is, let's say, smoking marijuana or some drugs he or she is taking before being adult, that is also under juvenile delinquency. So many a time POSCO Act is not applicable there. But for child sexual abuse, POSCO Act is definitely applicable. So the better answer will be D. I know these are some of the different type of question, but all of these are mostly being asked, and we have to be equipped with this type of question. Droplet precaution and isolation is to be done for all of the following condition, except, of course, if it is varicella zoster, it is not transmitted by droplet infection. So for varicella zoster, we need not to do the isolation. And out of these, in case of pertussis, it is most commonly spread by the sputum and all. And then measles also has a high rate of transmission. And rate of transmission, infectivity rate is estimated by secondary attack rate. That help us in knowing rate of infection. Okay, coming to this question. Whenever a big question come in your exam, always remember that you have to start with lower line first. Vidal test negative, RK39 is positive. Where do we use RK39? In case of Kala Azar. And in case of Kala Azar, what is the drug of choice? So it is same that we use in black fungus, liposomal amphotericin B. So Kala Azar have liposomal amphotericin B as drug of choice. Second drug of choice is oral drug miltefosine. And third drug of choice is sodium stibogluconate. Okay. Now, can you answer me who transmit Kala Azar? Who is the transmitting agent of Kala Azar? Who is transmitting Kala Azar? Who is the transmitting agent? The transmitting agent of Kala Azar is sandfly, phlebotomus. Very good. Phlebotomus sandfly. And this phlebotomus or sandfly transmit two more diseases, oriental sore, Oraya fever. So you can remember the disease transmitted by sandfly by the simple mnemonic Kala Azar. Kala Azar. That means oriental sore, Oraya fever, Kala Azar by sandfly. Okay. Next question is which state is not endemic for Kala Azar? So Kala Azar are endemic in 4 states of India. Bihar has most case. Then brother of Bihar UP, neighbor of Bihar UP. Then there is West Bengal and the brother of Bihar, Jharkhand. So all the states which has border touching Bihar, they are endemic for Kala Azar. Bihar, then of course Jharkhand, UP and West Bengal. Not Assam. Okay. Next question. Again, they have given the question from this part. I think it's an easy one. Try to give the answer before I come to the answer. Number of cases last week is 42. This week 43. So it is within expectation. And whenever it is within expectation, you know what we call it. Last week it is 2. This week 42. So it is much more than expected. And last week 6. Present week 1. It means it is totally random cases are occurring. Sometimes 6, sometimes 1. So first one is definitely endemic. Within expected number, endemic. Much more than expected, epidemic. And random occurrence of case is sporadic. So the correct answer will be C. Endemic, epidemic, sporadic. This question, they are saying they have given A, B, C, D as 4 pointers. And they are asking that in the natural history, which point marks onset of symptom? कौन बता रहा है सिम्टम स्टार्ट होने का टाइम? तो देखो, पॉइंट ए है स्टेज ऑफ ससेप्टिबिलिटी, और यहां से स्टेज ऑफ सब क्लिनिकल स्टार्ट. सब क्लिनिकल मींस इट इज अनडिटेक्टेबल बिफोर दिस पॉइंट C. It is all this subclinical means not coming to clinic, undetected. So it is undetected till B. When C come, symptom start, and then there is state of clinical disease. So what is telling us onset of symptom? Point C, onset of symptom. Okay. Now, in this question, what is this point D? Point D is just telling me the clinical stage, when the symptoms are there. Do remember one more definition which sometimes they ask, what is lead time? Lead time is the time gap between screening test and diagnostic test. Earliest point where we can diagnose and the usual diagnostic test. The time gap between these two is lead time. Okay. Now, let's move ahead and come to the next question. Researcher find out a sensitive test to be positive for a person. For diagnosis, which of the following will hold true? So sensitive test is positive. Sensitive test positive means that you are including people who are having disease and you are also including those people who are without disease. Remember this thing, high sensitivity का मतलब होता है high false positive भी. समझो क्या कहने का मतलब है. देखो, नीट एग्जाम का पीजी में एडमिशन लेने का कट ऑफ हो गया है 0%. 0% मींस आप बस पीजी एग्जाम में बैठ जाओ, पैसा है तो आप कॉलेज उठाओ. इन पीजी दे आर पुटिंग 0% एंड देन व्हाई दे आर wasting your time with this exam, है ना? They should let you also work. India is anyway in need of so much of doctors. But anyway, come to the point. If the cutoff of NEET exam lowered from 50 to 0%, now more student will pass. And remember, sensitivity is ability to include. So more student will pass means more will be included. High sensitivity. When the sensitivity will be high? When we lower cutoff. If we cutoff is lowered, more people will pass, sensitivity will be high. And when sensitivity will be high, all the students who are prepared, they will pass. So true positive, that means prepared student, they will increase. And they will not fail due to nervousness or anything, because now they're 0%, so no one will fail anyway. But because the cutoff is 0%, a lot of those students who have not at all studied, they will also get PG seat. And they are the students who are false positive. False means not studied but pass. Like recently the news came that a student had minus 13 mark in NEET and he got radiology. So that was false positive. He passed without studying. So when you lower cutoff, a lot of those people will come who don't have the disease, wrongly came positive. False positive means false alarm. There is no disease but still the report came positive. False positive are those patients who are without disease but came positive. Patient without disease. So what does it mean? If the sensitivity is high, a lot of patient will be without disease in the group. High sensitivity, a lot of patient don't have the disease. So let's see the option which correlate with that. High sensitivity confirm that the person does not have the disease. It does not confirm it. And there is a chance that person don't have the disease, but it does not confirm it. It suggests that if the disease is rare, the person surely has the disease. Okay, let's see other options. It confirms that the person has the disease if the disease is common. Yes, this looks like more of a correct answer. And it has an expected finding in case the disease is prevalent. It is an expected finding in case the disease is prevalent. No, it's not like that. Let me explain all the four options one by one. First thing is that you have to remember this very important question in NEET exam also. Positive predictive value is directly proportional to prevalence of disease. If there are more people who are having the disease, PPV of the test will be high. Like if I did pap smear on sex worker who have high chance of cervical cancer, then the PPV of pap smear will be high. Okay, so high PPV if more patients are there. Simple. So PPV depend on how many people have the disease, but sensitivity and specificity, they are fixed for a test. Sensitivity and specificity do not depend on prevalence. They are fixed for test. ज़्यादा लोग बीमार हो या कम, सेंसिटिविटी स्पेसिफिटी में फर्क नहीं पड़ेगा. पीपीवी ज़्यादा लोग बीमार होंगे तो पीपीवी ज़्यादा आएगा. ये इंपॉर्टेंट क्वेश्चन है, याद रखिएगा. तो जो ऑप्शन डी है, एक सेंसिटिविटी, हाई सेंसिटिविटी इज एक्सपेक्टेड फाइंडिंग इन डिजीज इज प्रिवलेंट. नो, if disease is prevalent, high PPV is expected. High sensitivity is not expected. So if they would written high PPV, if disease is highly prevalent, then option D can be right. Okay? और option A में word use किया है confirm, option C में word use किया है confirm. And all this test sensitivity, specificity of any test like RT-PCR or anything, they never confirm the disease. They only tell us the risk. They only suggest something. अगर किसी का HIV मेरा पॉजिटिव आ जाए तो क्या आप मान लोगे कि मुझे HIV है? मत मानना, क्योंकि मैं फॉल्स पॉजिटिव भी तो हो सकता हूं. I can become HIV positive wrongly also ना. So it never confirm. That's why AC is rule out, D is rule out. So correct answer is B. And in exams, a lot of time, if you are going with a fresh mind, you can answer many of such question even without knowing them by ruling out other options. देखो ऑप्शन बी क्या है, एक बार पढ़ते हैं फिर से. It suggests that if the disease is rare, the person surely has the disease. देखो, suppose sensitivity is let's say 98%. तो सेंसिटिविटी इज 98%. इट मींस कि आउट ऑफ 100 people who have disease, 98 are coming true positive. सेंसिटिविटी का यही डिफिनेशन है, ट्रू पॉजिटिव बाय डिजीज. ओके, सो आउट ऑफ 100 people who have disease, 98 were caught. High sensitivity simply means that. Now, दो लोग क्या हुए, 100 बीमार थे, 98 पकड़े गए, 2 बच के निकल गए, गलती से निगेटिव आ गए, फॉल्स निगेटिव. फॉल्स निगेटिव हमने पहले अभी बात भी करी कि सेंसिटिविटी का फॉर्मूला याद करना बड़ा आसान है. आपको बस याद करना है ट्रू पॉजिटिव, और नीचे में ट्रू पॉजिटिव और उसका जस्ट उल्टा. ट्रू का उल्टा फॉल्स, पॉजिटिव का उल्टा निगेटिव. तो क्या होगा, ट्रू पॉजिटिव बाय ट्रू पॉजिटिव प्लस फॉल्स निगेटिव. तो फॉल्स निगेटिव कितने बचे, सिर्फ दो लोग बचे. और फॉल्स निगेटिव का मतलब होता है मिस आउट, जिनको पकड़े जाना था लेकिन नहीं पकड़ाए, बच के निकल गए, मिस आउट हो गए. तो इफ सेंसिटिविटी इज हाई, टेस्ट का सेंसिटिविटी ज्यादा है, तो बच के निकले हुए लोग कम होंगे. अगर सेंसिटिविटी ज्यादा है तो फॉल्स निगेटिव या जो लोग बचेंगे वो कम होंगे. जैसे आरटीपीसीआर का सेंसिटिविटी 80% है, तो 100 लोग अगर बीमार हैं तो 80 पकड़े जाएंगे, केवल 20 बच के निकल जाएंगे. ओके, इफ सेंसिटिविटी ऑफ आरटीपीसीआर 80% मींस 80 विल बी कॉट, ओनली 20 विल बी मिस्ड आउट, 20 विल बी फॉल्स निगेटिव. तो ऑप्शन सी इज सेइंग कि इफ डिजीज इज रेयर, प्रिवलेंस इज लो, person surely has the disease whoever is coming positive. If you are coming positive and the sensitivity is high, if the disease is rare, the person sure, no. This option B is also not correct. If the disease is rare, person surely has the disease. But I got stuck in my question, and it can happen, but it was the disease is rare, prevalence is low. So prevalence is low and sensitivity is high. Does it mean that person surely has the disease? We can say that, but not with 100% sure. Surely is a word which is causing trouble to me. ये जो surely word लिखा है उसके चलते मैं थोड़ा सोचने लग जा रहा हूँ. It confirms that the person has the disease if the disease is common. Person has the disease if the disease is common. I think the best answer out of these 4, of course D is ruled out. The best answer can be C. देखो मैंने अभी बोला था कि कंफर्म वर्ड लिखा है तो वो गलत होगा, लेकिन ऑप्शन बी में भी तो श्योरली वर्ड लिख दिया, तो तीनों के तीनों में वो प्रॉब्लम है. लेकिन मैं क्यों सी को सही कह रहा हूं, क्योंकि ये कंफर्म कह रहा है कि पर्सन को बीमारी होगी अगर बीमारी कॉमन है तो. जैसे जब कोविड 2021 में हो रहा था, जब बहुत से लोगों को कोरोना फैल चुका था, उस टाइम जितने भी लोगों को कोरोना पॉजिटिव आ रहा था आरटीपीसीआर में, उन सबको बीमारी हो रही थी. 2020 में ऐसा नहीं था. 2020 में आरटीपीसीआर पॉजिटिव आता था लेकिन बंदे को कोई सिम्टम नहीं होता था. तो इन 2020 व्हेन द डिजीज वाज रेयर, इफ द डिजीज इज रेयर एंड यू आर कमिंग पॉजिटिव, इट डजंट मीन यू हैव द डिजीज. जब 2020 में आपको बीमारी कम लोगों को थी, उस टाइम अगर आरटीपीसीआर पॉजिटिव आ रहा था तो जरूरी नहीं है कि आपको कोरोना है. यानी ऑप्शन बी जो है वो गलत है. अगर डिजीज रेयर है जैसे 2020 मार्च अप्रैल में, तब जरूरी नहीं है कि आपको बीमारी हो, है ना. यानी ये श्योरली लिखना गलत है, ऑप्शन बी गलत है. लेकिन 2021 में जब कोरोना कॉमन हो गया, तब अगर आरटीपीसीआर पॉजिटिव आ रहा था तो उन लोगों में पक्का कोविड निकल के ही आ रहा था. तब आरटीपीसीआर गलत रिपोर्ट नहीं दे रहा था 2021 में, क्योंकि उस टाइम बीमारी कॉमन हो गई थी. तो बीमारी कॉमन जब होती है तब सेंसिटिविटी हाई है, टेस्ट में पॉजिटिव आएगा, तो यानी पर्सन को बीमारी है. तो इसको कैसे याद करोगे इस पॉइंट को, और मैं भी कंफ्यूज हुआ. आई एम रियली सॉरी फॉर दैट. एक्चुअली मैं कंफर्म वर्ड से कंफ्यूज हुआ. मुझे जल्दी डिसीजन नहीं लेना चाहिए था. बट एक बात याद रखना कि अगर प्रिवलेंस कम है, अगर कम लोग बीमार हैं, इफ प्रिवलेंस इज लो, प्रिवलेंस इज लो का मतलब क्या होता है, बीमारी रेयर है, डिजीज इज रेयर, तो इस केस में फॉल्स पॉजिटिव ज्यादा आएगा. फॉल्स पॉजिटिव इज हायर. जैसे 2020 मार्च के टाइम में, अप्रैल के टाइम में जब कोरोना नया था, तो इन दैट मार्च अप्रैल टाइम इफ समवन इज कमिंग पॉजिटिव, मोस्ट लाइकली दे वेर फॉल्स पॉजिटिव. ओके, तो ऑप्शन बी में यही लिखा हुआ था कि इफ प्रिवलेंस इज लो, पेशेंट श्योरली हैव द डिजीज. नो, पेशेंट कैन बी फॉल्स पॉजिटिव, ही डज नॉट श्योरली हैव द डिजीज. बट इफ प्रिवलेंस इज हाई, when the prevalence is high means many people have the disease. In that case, false positive is low. False positive low means if someone is coming positive, he will mostly have the disease. सीधी सी बात है, अगर बीमारी रेयर है जैसे कैंसर वगैरह में, तो पॉजिटिव आने का सीधा मतलब यह नहीं है कि मरीज को कैंसर है, वहां फॉल्स पॉजिटिव भी हो सकता है, इसीलिए हम बायोप्सी से ही कैंसर को कंफर्म करते हैं. इफ डिजीज इज रेयर लाइक कैंसर, then it can also be false positive. That's why we confirm it by biopsy. But if disease is common, like let's say common like TB, है ना, and then we are getting positive report, probably the patient have TB because false positive for TB is low because TB is very common. So if disease is rare, false positive high. If disease is common like TB, false positive is low. And line C is telling the same thing. If you look at the line C part, line C is telling the same thing. That person has the disease if disease is common. If disease is common, then positive report means patient have the disease. So correct answer will be option C. I am really sorry for the mistake which I did in hurry, but luckily I came to my consciousness and I corrected it, but really sorry for the mistake. Now coming to the next question, we have already discussed it. Maternal mortality ratio. What is that? Maternal death per 1 lakh live. Oh, I should have asked it from you. 1 lakh live birth. This is maternal mortality ratio. It has nothing to do with reproductive age group female. It is 1 lakh live birth. Now, what is the dose of iron and folic acid for adult women under Anemia Mukt Bharat? And can you answer it? What is the answer to this question? Remember, the doses for Anemia Mukt Bharat is very frequently asked and very easy to remember. In that meantime, give answer. If it is less than 5-year children, 6 month to 5 year, the dose is 20 milligram iron and 100 microgram folic acid. This is the dose. 20 iron, 100 folic acid. Very simple. 20 multiplied by 500. So 20, 100 for less than 5 year. And in less than 5 year, will you give high dose or low dose? छोटे बच्चे हैं, we will give low dose. So to give low dose, we divide it into 2 dose and we give it bi-weekly. हफ्ते में 2 बार 1 ml syrup देंगे. And in that syrup 20 mg iron, 100 microgram folic acid. Then the mnemonic is PVR. जैसे हम लोग PVR में जाते थे ना मूवी देखने और भी कुछ करने, तो उसी तरह PVR है. और PVR में मूवी हफ्ते में एक बार रिलीज होगी ना, once a week movie is released in PVR. So similarly in PVR tablets are given once a week. P for pink, it is 45 milligram iron and 400 microgram folic acid. This is for 10 to 19 year children. B stand for blue. एंड ब्लू इज फॉर एडोलेसेंट. ये क्वेश्चन आ चुका है एनआईसीटी में. ब्लू का डोज और रेड का डोज जो एडल्ट फीमेल के होगा ये सेम है. एंड बोथ ऑफ दीज ब्लू एंड रेड डोज आर 60 milligram elemental iron and 500 microgram folic acid weekly. Just like movie are released weekly, tablet are given weekly. But this is for adult women. If I ask pregnant and lactating female, then answer will be option A. In pregnant and lactating female, it is given for 180 days. Okay, before delivery and after delivery daily. But in adult, it is option B. Yes, some of you had written A, but then you corrected B. Nazrul Islam, Ankush Rajwat, Sarif Sifat, Roger, Arju Malik, all of you are right. Very good. So you all are right. Answer is B. Do remember the doses of each age group. बहुत सिंपल है याद करना. 20 और 100. और ये देखो पिंक वाले जो हैं, पिंक आर द ग्रुप विच आर 5 to 9 ईयर. 5 to 9 4 साल का है, और यही 4 यहां भी है, 45 and 400. फिर 10 से लेके 19 साल, 10 to 19 इज द एज ग्रुप फॉर एडोलेसेंट. एंड हियर वी गिव ब्लू टैबलेट वंस ए वीक. सो बस 3 डोज याद रखने हैं. 20 100 अप टू 5, फिर 45 400, 4 दोनों में, 45 400, एंड लास्ट डोज इज दिस ओनली 60 and 500. ब्लू कलर फॉर एडोलेसेंट 10 to 19 ईयर, रेड कलर फॉर एडल्ट फीमेल, रेड कलर. ओके, तो ये डोजेस जरूर याद रखना. और एक और बात, जो क्वेश्चन आ चुका है कि एनीमिया मुक्त भारत इज हैविंग 6 into 6 into 6 स्ट्रेटेजी. बड़ा ही छक्का प्रोग्राम है. सो इन दिस 6 into 6, द फर्स्ट 6 इज द पीपल हु विल गेट बेनिफिट. सो दीज आर बेनिफिशियरी. Second 6 are the benefit which we will give, and last 6 are the institutional mechanism by which we give the benefit. Institutional mechanism. Now, what are the 6 benefit which we give? पहला बेनिफिट है IFA टैबलेट. सेकंड बेनिफिट है साल में 2 बार अल्बेंडाजोल, बाई एनुअल डीवॉर्मिंग अल्बेंडाजोल. थर्ड बेनिफिट है BCC, because they have asked a lot of questions from here, so they can ask the benefit. Be ready for it. BCC, what is BCC? Behavior change communication. ऐसी वाणी बोलिए मन का आपाक होए और इनको शीतल करे आप हो शीतल होए. In BCC, government is focusing on solid body, smart mind. You will, if you have to give this tablet to mother, you will say to the mother, if you will take the tablet, your child will be smart after birth. He will come first in the class, so she will take it. And if you have given it to the small children, you will say to them that if you eat this tablet, you will be strong to kick butt of all the children in the colony. So they will take it for solid body. So solid body, smart mind. This is BCC. Third benefit. Fourth benefit is the food fortification with iron folic acid. This is the fourth benefit. Food fortification with iron and folic acid. The fifth and last benefit is digital hemoglobin measurement and follow-up of high-risk anemia cases. Digital HB measurement. HB measurement and follow-up of high-risk cases. So how many benefits we found here? Iron folic acid, albendazole deworming biannual. Biannual we do 10th February is the National Deworming Day, and then 10th of August after 6 months we do it. Third benefit is BCC. Fourth benefit is food fortification, adding iron and folic acid in the food. Fifth benefit is digital hemoglobin measurement. And last, sixth benefit, government said was focus on other cause of anemia as well, like malaria and sickle cell anemia or fluorosis. High fluorine in water can also cause anemia. So this is the last benefit, focus on other cause of anemia as well. Thank God government told us to focus, otherwise we would have forgotten. So remember the sixth benefit which can come in this exam. Now this is one thing which has not been asked till yet. Chalo, next question. Which of the following is true regarding Nikshay portion? We just discussed how much money we give. 500 rupees per week, per month, per day. Per week, per month. Per month. So if you divide 500 rupees with 30, it will come around 17-18 rupees per day. तो सरकार 18 रुपए पर दिन दे रही है और कह रही है कि जा सिमरन जी ले अपनी जिंदगी. क्या आएगा 18 रुपए में? छोटी गोल्ड फ्लेक्स, छोटी चाय. ठीक है, कुछ तो मिल रहा है. So that is the point which is given. Nikshay portion. Now, next question is that diphtheria vaccine is which type of vaccine? It looks simple, but it can be confusing. Can you answer it? Please do reply. Diphtheria is definitely a toxoid along with tetanus. Tetanus and diphtheria are toxoid vaccine. Polysaccharide vaccine are 3. VI polysaccharide for typhoid. Then there is pneumococcal and meningococcal. देखो भाई यहां से 2 क्वेश्चन आते हैं, ध्यान से समझो. पहला क्वेश्चन बड़ा आजकल पूछ रहा है ये कि there is an old age patient or there is a patient went through splenectomy. Which of the following vaccine is given? So old age में post splenectomy में क्यों मरते हैं लोग? निमोनिया से. So in old age, post splenectomy, in all these things, we will give pneumococcal. Whenever the patient is immunocompromised, HIV patient and all, which vaccine is given? Pneumococcal. And in meningococcal, the strain is ACY-W135. So they ask which subunit is not present in meningococcal vaccine. B subunit is not present. B is not there. A, C, then Y, and W135. Okay, that is there. Chalo. Now, there is a very common question which they ask from here is that if there is an immunocompromised child or a nephrotic syndrome child on steroid, which vaccine is not given to that immunocompromised child? So we all know live attenuated vaccines are not given in pregnancy in immunocompromised child, except yellow fever, which can be given in pregnancy. And they have asked in MCI exam already that yellow fever vaccine protect for how long? It protect 10 day to lifelong. So except yellow fever, all live vaccine are not given in immunocompromised and pregnancy. So if you know all the live vaccine, you can easily answer which you will not give in immunocompromised. Answer will be live. समझ रहे हो कि नहीं? आपको बस ये पता लगाना है लाइव कौन है, वही हम नहीं देंगे. तो आपको इसके लिए सारे लाइव याद होने चाहिए. और सारे लाइव याद करने के लिए एक बड़ा ही अच्छा निमोनिक है, CP पे आइजो. कम टू CP. क्या करोगे CP पे आने पर? CP पे आके क्या करेंगे? BMW कुछ एक और उन्होंने बताया था. आते इस पे आते हैं. What is this CP पे आइजो? CP पे आइजो stand for C is for cholera, P is for polio, second P is for plague, I is for influenza, and J is for Japanese encephalitis. And all these 5 vaccines, CP पे आइजो, they are both live and killed. तो आपको लाइव और किल्ड दोनों याद करने में ये हेल्प करेगा, सीपी पे आइजो। फिर बी से क्या है, बीसीजी। एम से क्या है, एमएमआर। इसके अलावा और कौन कौन है, रोटा वायरस, येलो फीवर एंड वेरिसेला। ओके, तो रोटा वायरस, येलो फीवर, वेरिसेला, बीसीजी, एमएमआर, ये वैक्सीन है। ओके, कैसे याद करोगे इसको, राइड करेंगे, बीएमडब्ल्यू चल रहा है क्या, नहीं ना, बस याद कर लो ना यार। CPPI जो रोटा वायरस, येलो फीवर, वेरिसेला, हुज स्ट्रेन इज ओक्का स्ट्रेन, एंड देन BCG एंड MMR. These are the vaccines which are live vaccines. They are not given immunocompromised or HIV positive patients and all. Killed vaccines कौन कौन से हैं? Very simple. 5-7 हैं टोटल, but very simple. 5 are CPPI जो cholera, plague, polio, influenza, J. Same 5. Then hepatitis A is killed and rabies is killed. So total 7 are killed. I hope this classification you will remember. Next question. What is the ratio of incidence of disease in the exposed to that of non-exposed? What is the answer? ये tricky question है, बताइए आंसर। जयपुर जैक्शन बेस्ट निमोनिक बनाया है। Boy loves the crime. Oh, and he correlated it. Okay, you can go through it. BCG, OPV, yellow fever, boy, and then he made it. Okay, very good. Next question. Tell me, what is the answer to this question? What is your answer? Some are saying C, some are saying D. Some are saying A also. देखो, here they are saying incidence of disease in exposed to incidence of disease in non-exposed. Two words they have used. This is relative risk. And relative risk is the best way to know strength of association. दो चीज कितनी स्ट्रांगली जुड़ी हैं, ये बेस्ट रिलेटिव रिस्क से पता चलता है, स्ट्रेंथ ऑफ एसोसिएशन। अगर इसी टू की जगह उन्होंने माइनस वर्ड यूज कर लिया होता, then the answer will have attributable risk. Because what is the formula of attributable risk? Attributable risk is incidence in exposed minus incidence in non-exposed divided by incidence in exposed into 100. This is attributable risk. और जहां भी attributable risk होगा, क्वेश्चन में ड्यू टू वर्ड होगा या ऐसा लिखा होगा। जैसे स्मोकिंग कॉजेज लंग कैंसर, सो लंग कैंसर इज ड्यू टू स्मोकिंग, सो दे आर टॉकिंग अबाउट एट्रीब्यूटेबल रिस्क। और लास्ट एक फॉर्मूला है पॉपुलेशन एट्रीब्यूटेबल रिस्क। सो इफ दे यूज द वर्ड माइनस, माइनस इज इन AR, टू वर्ड RR, करेक्ट आंसर इज RR, रिलेटिव रिस्क। नाउ व्हाई इट कैन नॉट बी ऑड्स रेशियो? ऑड्स रेशियो क्यों नहीं होगा? बिकॉज ऑड्स रेशियो आर कैलकुलेटेड इन केस कंट्रोल स्टडी, एंड द अदर नेम ऑफ ऑड्स रेशियो इज क्रॉस प्रोडक्ट रेशियो। ऑड्स रेशियो का ही दूसरा नाम है क्रॉस प्रोडक्ट रेशियो। एंड इन केस कंट्रोल स्टडी वी गो इन पास्ट, एंड इन पास्ट वी कैन नेवर फाइंड द इंसिडेंस। आप ही बताओ ना, आपको आपकी नई गर्लफ्रेंड, नया बॉयफ्रेंड कहां मिलेगा, पास्ट में या फ्यूचर में? ऑफ कोर्स इन फ्यूचर यू विल हैव योर न्यू बॉयफ्रेंड और न्यू गर्लफ्रेंड। सो इंसिडेंस मीन्स न्यू केस, एंड न्यू केस कैन ओनली ऑकर इन फ्यूचर, इट कैन नॉट ऑकर इन पास्ट। सो केस कंट्रोल can never find incidence. Incidence can only find in cohort. That is why cohort study is also known as incidence study. So the answer is relative risk here. And what is the formula of population attributable risk? We write incidence in population minus incidence in non-exposed by incidence in population into 100. तो इन फॉर्मूले को याद करने के लिए देखो क्या करना है। एक छोटा सा काम है, exposed here and exposed here is there in attributable risk. आपको इस exposed को बदल देना है population से। You just have to change exposed by population. AR will become PAR. AR is exposed minus non-exposed by exposed. PAR is population minus non-exposed by exposed. So just change exposed by population, it will change. Next question. In a screening test for diabetes mellitus, out of 1000 population, 90 were positive. However, a gold standard said that 100 were positive. So, what is the sensitivity of the screening test? Try to answer it. I am waiting for your reply. What is the answer? See there. The definition of sensitivity is that sensitivity का मतलब है true positive out of total disease. जो पूरे लोग बीमार थे उनमें से कितने सही पकड़े गए, true positive by total disease. Now, in this question, all of you are writing C, 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 C. Mostly answer is coming C. Some are saying A. Okay. No, only Roger Wine has written answer many times as C. Okay, come here. Dear friend, पहले बार 90 पकड़े गए तो 90 were being caught, 90 were true positive. गोल्ड स्टैंडर्ड से हमें यह पता चलता है कि एक्चुअली में बीमार कितने थे. गोल्ड स्टैंडर्ड टेल अस टोटल डिजीज. सो गोल्ड स्टैंडर्ड इज गिविंग 100. सो टोटल डिजीज इज 100, ट्रू पॉजिटिव इज 90. आंसर इज ए, 90 by 100. ओके, नेक्स्ट क्वेश्चन. इंसिडेंस ऑफ डिजीज इज 4, एवरेज ड्यूरेशन इज 2 ईयर. व्हाट इज द प्रिवलेंस? देखो ये सारे न्यूमेरिकल के लिए पेन नहीं चाहिए, इसलिए एग्जाम में आ सकते हैं. देखो प्रिवलेंस का एक फॉर्मूला है. Prevalence is incidence into duration of disease. And in this question, incidence is given 4 per 1000. Duration is 2 year. So 4 per 1000 into 2, answer will be 8 per 1000. ठीक है, बट यहां से 2 क्वेश्चन और आते हैं कि if a new drug does not cure disease but prevent death from it, drug does not cure but prevent death, what will be the effect on prevalence? जैसे बीपी और शुगर की दवा, जो बीपी शुगर का इलाज नहीं करती है बट लोगों को बीपी शुगर से मरने नहीं देती. तो बिकॉज बीपी शुगर मेडिसिन डू नॉट क्योर, ओनली प्रिवेंट डेथ, सो पीपल सफर फॉर लॉन्गर ड्यूरेशन. एंड व्हेन पीपल विल सफर फॉर लॉन्गर ड्यूरेशन, प्रिवलेंस विल बी मोर. सो इफ ड्रग डज नॉट क्योर बट प्रिवेंट डेथ, इट विल इंक्रीज प्रिवलेंस. बट टेल मी वन थिंग, even if a new drug for BP sugar come in the market, will it prevent new people from falling ill to diabetes? No ना, नई बीमार दवा आने से नए लोग थोड़ी बीमार पड़ने कम हो जाएंगे. So remember, whenever I ask drug, in case of drug, incidence is almost same. So incidence always remains same, and prevalence depend on duration. If the disease is not curing it, duration will be more, and more people will suffer. And based on this same concept, if they ask what is the most common cancer of the world, is it breast cancer or lung cancer? Answer is breast cancer. Because breast cancer people survive for 5 years, 10 years, sometimes 15 years. And you have seen the formula. If the duration is more, prevalence will be more. This is written in Park table, so do trust this data. क्योंकि कभी भी आप देखोगे ब्रेस्ट कैंसर के हजारों लोग बचे हुए हैं, तो एक समय पे जब आप नापोगे सबका काउंट, तो breast cancer patients will be much higher because they are surviving longer. Lung cancer patient die within 1-2 year of survival, so that's why lung cancer is not that high prevalence. Most common cancer of world is breast cancer. Now, most common cancer of female of India, is it cervical cancer or breast cancer or oral cavity? Again, answer will be breast because of the same logic. Cervical cancer do not survive long. Breast cancer survive long, so anytime prevalence of breast cancer will be more than cervical cancer or lung cancer. Okay, please trust on this data. This is from Park directly. Most common cancer in male of India. They have asked in MCI exam already. Male of India, oral cavity cancer. कैसे पता लगाओगे? 2 उंगली डालोगे कहां पर? यहाँ पे. By finger examination of oral cavity is done. And if they ask most common cancer in male of world, तो क्या लिखोगे? Tetta cancer? No, lung cancer because they are smoking a lot. Okay, do remember it. Next question. Probability that infection will occur among susceptible person following contact with infectious person within the incubation period. Okay, so first one person got infected, then other are getting infected. So that means they are talking about secondary attack rate. One person got infected, then other are infected. Within one incubation period is secondary attack rate. Case fatality rate tells us virulence or killing power. How dangerous the disease is. That is what case fatality rate tells us. Like they have asked, what is the case fatality rate of rabies? 100%. So case fatality rate simply means that out of total case, how many people die due to that disease? How many deaths due to that disease occur? Multiply by 100. And it is telling virulence or killing power, very commonly asked, do remember it. Okay? Chalo. Next. Which of the following does not cause hardness of water? You must have seen when you boil water, sometimes white thing deposit on the vessel. That white thing is calcium carbonate. It does not cause hardness, it just deposit after boiling. So calcium carbonate and calcium gluconate, these are not responsible for hardness of water. Calcium gluconate and calcium carbonate, not responsible for hardness. Which of the following is not a method of direct transmission of communicable disease? If it is coming through soil, it is not direct. Direct means respiratory route or droplet and all. What should be the minimum interval between administration of 2 live vaccine? 4 weeks. Okay, if they are given at the same route, then they should be given at a gap of 4 weeks. Kala-Azar is not endemic in, we have discussed that Bihar, UP, West Bengal, which are sharing border, and Jharkhand, they are endemic. Assam is not endemic. Triage is done. We all know which one is correct for triage. First come, first treat is not triage. Triage means those who need care should be given care first. And green level are for transported on priority or ambulatory patient. Ambulatory is green. Ambulatory means they can be moved from one place to another. And they are not running like ambulance, but at least can be moved. So ambulatory patients, category green, this is correct answer. Now, in MCA exam, they have asked, in which category you will put the patient who are relatively stable. Relatively stable patient will go in which category? बताओ तो क्या लगता है इसका आंसर? Relatively stable patient कहाँ जाएगा? Yellow में, green में, red में. So we all know red is for those category which need life-saving surgery in less than 6 hours. They are red. Okay. Yellow are relatively stable patient. They are stable as compared to red. They need surgery within 24 hours. And green are those which are stable patient. Green just need dressing, cast or stitches. So relatively stable is yellow, surgery within 6 to 24 hours. Okay. And black is of course moribund patient. But in war, when we do reverse triage, then first priority is given to green. Okay, in case of war. Okay, next question. A paradoxical carrier. Who is a paradoxical carrier? A paradoxical carrier is one who acquired pathogen from another carrier. Okay, that is a paradoxical carrier. Convalescent carrier is the one who acquired pathogen from the patient. Okay, this is convalescent. These are two definitions which you have to remember. Convalescent carrier means I am a patient, I infect you, so you become a carrier, convalescent. But I am a patient, but there is no symptom. So I am also a carrier and I transmitted infection to you. That is paradox, unexpected. So it is paradoxical carrier, option B. Which of the following vaccine is contraindicated in pregnancy? So all the live vaccine are contraindicated, and we just discussed varicella is a live vaccine, so you will not give varicella. Which of the following is not a personal protective equipment? So lab coat is not personal protective. Lab coat is added to it. Goggles, gloves, face sheet, they are personal protective equipment. And where will you throw the PPE kit? The plastic PPE kit is the real one, and it always goes in red. PPE kit goes in red. What is the best way to plot the changes in incidence of a disease over time? If they ask over time, answer is, this is a separate question which I am asking. Incidence of disease over time, this is known as incidence rate. This question has been asked 2 years back in MCI exam. The number of new cases added over time is known as. So new cases over time is incidence rate. But how will you plot them? Which of the 4 is the best way to plot incidence over time? Let's say I am plotting cases of cardiovascular disease, diabetes mellitus, hypertension, which is constantly increasing over the world from 1950 to 60 to 70 to 80 to 90. So this I am plotting with the help of line diagram or life graph. Line graph tell trend of event, that any event or incidence, whether it is increasing or decreasing. And this cardiovascular disease, diabetes mellitus and all, these are example of secular trend. देखो हम लोग कहते भी हैं ना कि ये लीडर सेकुलर है, ये नहीं. सेकुलर का क्या मतलब है? Secular means who is constant for all religion, and not just before election, even after election, and constant for a long period of time. That is secular. So here, diabetes mellitus, cardiovascular disease, hypertension, they are constantly increasing over a long period of time. That's why they are following secular trend. तो यहां से 3 क्वेश्चन आते हैं. पहला क्वेश्चन, secular trend is represented by which diagram? Line diagram. Second question, how do you represent trend of event? Line diagram. Third and most common question, which is an example of secular trend? Cardiovascular disease is example of secular trend. Okay? चलो अब ये बताओ कि इंडिया में सेकुलर लीडर कौन है? एक क्लास में ले रहा था, बच्चे ने बोला मोदी. मैंने बोला हाँ मोदी सेकुलर है और मैं नूरा फतेही हूं, है ना. चलो आगे बढ़ते हैं और एक ही क्वेश्चन पे आते हैं. नेक्स्ट, इफ ए पेशेंट टेस्ट पॉजिटिव फॉर ए डिजीज, which of the following represent the probability of her actually having the disease? अगर कोई पॉजिटिव है तो उसको कितना चांस है कि बीमारी होगा? इसी को कहते हैं पॉजिटिव प्रेडिक्टिव वैल्यू. पॉजिटिव प्रेडिक्टिव वैल्यू का मतलब यह है कि अगर कोई पॉजिटिव आ गया, ट्रू पॉजिटिव, तो कितना चांस है कि इसको एक्चुअली बीमारी है. Okay, because it is PPV means true positive out of total positive. जितने पूरे पॉजिटिव आए हैं उसमें से कितनों को पॉजिटिव भी है और बीमारी भी है, डिजीज भी है और पॉजिटिव भी है. So this is PPV, probability of a person having the disease out who are coming positive on test. Which of the following represent the probability of the person who is coming positive actually having the disease? That is PPV. और एक बात अभी हमने पहले भी पढ़ी है, याद रखना, PPV is directly proportional to prevalence of disease. तो PPV directly proportional to prevalence, ये भी याद रखना. जब बीमार ज्यादा होंगे तो PPV ज्यादा होगा. Okay. Next question. That's what I was about to draw there, but it's good that is here. In a natural history of disease flow chart, what is A to C is called as? A to C को क्या कहोगे? तो A is first point of diagnosis and C is usual time of diagnosis. First time of diagnosis to usual time of diagnosis is known as lead time. इसी को lead time कहते हैं. और what is the screening time? Can you tell what is the screening time in this graph? देखो, screening time is that duration before which if you detect, you can do some intervention and prolong the survival of the patient. So if you are detecting a disease after critical point of spread, the disease has already spread and there is no point of detecting it. Critical point मतलब फैल गया, तो इसके बाद स्क्रीनिंग करने का कोई फायदा नहीं है. We have to do screening before B. And before A, you cannot detect it. It is first point of detection. So this A to B, this point A to B, this is screening time. कैंसर फैलने से पहले पता लगाओगे और फर्स्ट पॉसिबल पॉइंट के बाद पता लगाओगे. तो A to B is screening time and A to C is lead time. ओके, क्या आप लोग लीड टाइम समझ रहे हो? अगर आप चाहते हो कि इफ यू वांट आई शुड एक्सप्लेन देन लेट मी नो. ओके, चलो नाउ नेक्स्ट क्वेश्चन. व्हाट इफ यू वांट मी टू एक्सप्लेन लीड टाइम, यू कैन ऑलवेज आस्क. द फॉलोइंग डायग्राम चार्ट द पॉपुलेशन चेंज ओवर ईयर. Which is this statistical diagram which we are using here? So first thing is, if you find gap again and again, it is definitely a bar diagram. And in the bar diagram, if there is one color of plot and one color above it, it means one above another, component bar diagram, option C. But if you found a plot in which they have two graph and then some gap, then again two graph and then some gap and then again two graph like this, this is known as multiple bar. तो मल्टीपल बार में भी बार बार गैप आएगा, बट दो दो तीन तीन बार के बाद, दैट इज मल्टीपल बार. एंड इफ देयर इज वन अबव अनदर, कंपोनेंट बार. एंड इफ इट इज सिंपली लाइक दिस, वन बार देन अनदर बार, दिस इज सिंपली बार डायग्राम. ओके, एंड देयर इज वन न्यू मेथड ऑफ टेलिंग क्वालिटेटिव डेटा, दैट इज नोन एज फिश डायग्राम. क्वालिटेटिव डेटा कैन ऑल्सो बी टोल्ड बाई फिश डायग्राम. फिश डायग्राम कैसे दिखाओगे? जैसे मान लो देयर इज सम रीजन, सपोज आई एम ओबीज, सपोज आई एम ओबीज. So there are multiple factors which lead to obesity. Now this can be explained like a fish, like my lack of exercise, my online food ordering, my mother food, other things. So this type of qualitative data representation is also fish diagram. Okay, and this is component bar diagram. अगर इसी diagram में मैं सारे gap को हटा के दिखाता, जोड़ देता सबको ऐसा, one after another, after another, after another, then it would become histogram. Histogram do not have gap at equal interval. Bar diagram have gap again and again at equal interval gap. That is the characteristic of bar diagram. Okay, चलो एक इसी पे सवाल पूछता हूं मैं. If I am representing this data like this, what is this diagram? Is it a bar diagram, component bar diagram, multiple bar diagram, histogram? What is your answer? What is your answer? This is a histogram because gap not at equal interval. Okay, and let's say I'm telling you the data of Japanese encephalitis from 17 से 18, 19, 20, then in 2020, 21 COVID came and 0 case reported. So this is not a real gap. This is also telling us that in this duration there was 0 case of JE. So remember this point, that in histogram there is no real gap. The gap also tells something. हर gap कुछ कहता है. And the gap in histogram is not at equal interval, but in bar diagram it is always at equal interval. Okay dear? Very good. Clear. Chalo, next. Very good. Most of you were right. Future doctor Praveen Kumar, Medicine 360. Thank you for replying. Next question. Which of the following parameter would you use to check the efficiency of the surveillance system for malaria under National Vector-Borne Disease Control Program? Efficiency for surveillance system. That means whether people are making slide or not. Surveillance system जमीन पे काम कर रहा है कि नहीं, slide बन रही है कि नहीं, ये कैसे देखेंगे? And this is detected by annual blood examination rate. This is best indicator of operational efficiency. लोग काम कर रहे हैं कि नहीं, ये सही से कैसे पता चलेगा? ABER से. ओके, ABER का फॉर्मूला है कि आउट ऑफ टोटल पॉपुलेशन how many slide made out of fever case, and it is multiplied only by 100, not by 1000, because ABER comes in percentage, so multiplication is by 100. Here we made number of slide made from fever case. कितना slide बना fever case से? Okay, so ABER tells us whether people are working, making slide or not. And who makes slide? I hope you all know. MPW makes slides. MPW is also known as health worker male. He visit every house in village once in 14 days, and if anyone had fever, he will make 2 blood smear from their blood. So this is which type of surveillance? That they have asked in one of the MCA exam 2 years back. This is active surveillance. Because health worker is going to the house and searching for hidden case. This is active surveillance. Passive means you come and report it to the hospital. Passive is notified. And if you mix active and passive, that becomes sentinel surveillance. Sentinel surveillance is for all cases. Okay. Now one last question here. Which of the following indicator tell about recent transmission of malaria? Whether malaria is recently transmitted or not. So recent transmission is detected by infant parasite rate. देखो भाई, अगर 1 साल से छोटे बच्चों के खून में मलेरिया का पैरासाइट है, तो इसका मतलब पिछले ही साल में मलेरिया फैला है. If less than 1 year have malaria parasite, it means malaria is recently transmitted. So that's why infant parasite rate tell about recent transmission. And which type of RDT kit which we have in malaria? There is 2 type of rapid diagnostic test kit. This is the question in NEET exam. That histidine-rich kit. This histidine-rich kit, will it detect Plasmodium falciparum or Vivax or both? What does histidine-rich protein kit will detect? So histidine-rich protein kit detect both. No, it detect only Plasmodium falciparum. Only Plasmodium falciparum का पता लगाता है. There is one more kit, which is optimal kit. Optimal kit have lactate dehydrogenase enzyme, and that optimal kit with lactate dehydrogenase enzyme, it can detect both Plasmodium falciparum plus Plasmodium vivax. Okay. Chalo, next question. Which of the following is false regarding confounding factor? देखो, confounding factor is an external factor which is related to both exposure and outcome. जैसे समझो, मान लो मैं बात करूं, अभी कुछ दिन पहले मैं एक अपने दोस्त प्रदीप से बात कर रहा था. उसने बोला कि मेरे पापा जी ने चाय पिया और उनको हार्ट अटैक आया, वो मर गए. अब वो बेचारा चाय नहीं पी पा रहा है बहुत दिनों से, तो टी से हार्ट अटैक होना तो चांस नहीं है. तो इस स्टोरी में कुछ एक्सटर्नल फैक्टर होंगे जिसने रोल प्ले किया होगा. टी क्या है? टी इज द एक्सपोजर रीजन व्हाई द हार्ट अटैक ऑकर्ड, एंड एम आई इज द आउटकम. ओके. अब इस स्टोरी में मैंने जैसे ही प्रदीप ने ये बताया, मैंने पूछा कि भाई ये बता, तुम्हारे पापा बीड़ी, सुट्टा, तंबाकू, गुटखा खाते थे क्या? तो बोले हाँ, बीड़ी तो पीते थे. तो स्मोकिंग इज वन फैक्टर. वी ऑल नो स्मोकिंग कैन लीड टू हार्ट अटैक. फिर मैंने पूछा दारू भी पीते थे क्या? बोले हाँ, दारू भी पीते थे. तो अल्कोहल इज अनदर फैक्टर विच लीड टू हार्ट अटैक. अब द वन फैक्टर विच इज रिलेटेड टू बोथ एक्सपोजर एंड आउटकम, जो चाय से भी जुड़ा है, हार्ट अटैक से भी जुड़ा है, दैट विल बी कन्फाउंडर. सो आउट ऑफ स्मोकिंग अल्कोहल, विच वन इज रिलेटेड टू टी? That will be confounder. कौन जुड़ा है चाय के साथ? सुट्टा या दारू? Of course, सुट्टा है चाय के साथ. Smoking is related with tea. तो smoking is confounder because it is related to both exposure and outcome. है ना? आपने भी चाय सुट्टा क्रॉनिकल देखा होगा, लेकिन कभी ऐसा देखा क्या कि एक पैक दारू, एक पैक चाय, एक दारू, एक चाय, नशा नहीं चढ़ रहा, चाय ले लेते हैं, नहीं ना? So alcohol is the effect modifier. Effect modifier वो होता है which is only related to outcome, not related to exposure. Okay. So this is a confounder, external factor related to both. So, but it is not distributed equally. It is distributed unequally. दुनिया में कोई भी चीज बराबर बटी है क्या? तो ये कैसे बराबर बटेगा? So it is distributed equally. This is a wrong statement. Confounder के बारे में 3 बात याद रखना. Confounding factor, first thing, related to both exposure outcome. Second point, it is unequally distributed in two groups. Unequally distributed. Third thing, the best way to remove confounder is randomization. So randomization and matching, they remove confounding factor. Okay, these are the two ways to remove confounder. Matching is the way to reduce it. Best way is randomization. Okay, चलो next question. यार ये बंद हो गया, इसको चार्ज में लगाना होगा. Bro, सिद्दीक भाई, इसको चार्ज में लगा दो. Now next question, which of the following is the best level of prevention of breast cancer? So early diagnosis and treatment is the best way. We cannot do other thing here. Best is early detection and treatment. What is the dose of vitamin A given to a 2-year-old baby with keratomalacia? The baby already have the disease, but still the dose will remain same. 2 lakh international unit immediately followed by the same. 24 hour by 2 week. As I have said, kya tha dose? 1, 2, 14. And that was the regime which I told. Today, tomorrow, and then 14 day or after 2 week. So this is the regime of treating vitamin A deficiency. 2 lakh, 1, 2, 14. In a normal curve, what is the percentage of distribution of one standard deviation? One standard deviation, 68% people come. So in one of the exam, they ask that mean plus one standard deviation have how much value, how much area or how much value? Option A, will it be 0.34, 0.68, 0.47, 0.95? What is the answer? Please give the answer to this question. Mean plus one standard deviation have how much area? Mean plus one standard deviation have how much area? Thank you so much, Siddiq bhai. Tell me, mean plus one, how much area? What is the answer? A, B, C or D? Please tell me. Dekho, this is mean. And between plus 1 and minus 1, in this area, 68% value lie. But I am not asking mean plus minus 1. I am only asking mean plus 1. So I am only talking about this area, half of 68. And half of 68 will be 34%. So mean plus 1 will have 34%, but mean plus minus 1 will have 68%. And if they ask mean plus minus 2, 95, mean plus minus 3 standard deviation, 99%. Do remember the 3 rule of standard normal curve. Rule 1 say that mean, median, mode all are equal to 0. Okay, that is rule 1. That's what Buddha said. Everything is 0, nothing is everything, everything is nothing. And rule 2 says, which commonly ask, standard deviation is equal to variance and this is equal to area under curve. And all these 3 things are equal to 1. Sabka malik ek. Jo Sai ne kaha, Kabir ne kaha, sab ne kaha. Ki standard deviation, variance, area, all are 1. This is rule 2. And rule 3 is what we have read. Mean plus minus 1, 68%. Mean plus minus 2, 95. Mean plus minus 3, 99% value. Do remember the 3 rules. Okay, next question. According to IMNCI, 6-month-old child is said to have pneumonia if the child has fast breathing with a respiratory rate. This you have to answer. We have discussed it in the class already. Less than 2 months, answer will be 60. 2 months to 1 year, answer will be 50. 2 months to 1 year. And more than 1 year, answer is 40. Okay, so this is very important to remember. Next question. This is a patient with diphtheria. Remember, diphtheria has 2 cases, 2 things. One is bull neck. Like, do I have a bull neck? This is double chin. Bull neck will have this swelling. है ना, मैं क्लास में से बता रहा था, उसने बोला सर आपका नेक ही नहीं है. मैंने बोला गुत्थी समझा क्या? ये देख, ये है ना नेक, है ना. So this is not bull neck. Bull neck will have this part of swelling. So bull neck and pseudomembrane. Pseudomembrane have clear margin and bleed on attempt of removal. That is a diphtheria case. Now they are asking what is false regarding diphtheria vaccine. Diphtheria is administered on the anterolateral aspect of thigh, correct. A prior adverse reaction with temperature above 37 degrees is a contraindication. If someone had fever in the last DPT vaccine, high grade fever, is it a contraindication? It's not a strong contraindication, and fever is something which is expected after DPT. That's why we give paracetamol syrup along with DPT vaccination. Cellular pertussis component in the vaccine is not recommended after 7 years. This is correct. In DPT, due to pertussis, we do not give after 7 years. है ना, after 7 years we only give DT. The diphtheria toxoid dose in adult is much lesser than pediatric dose. No, it's not the thing. It is not less than pediatric dose because toxoid dose is given as a stimulant for antibody, so the dose is not less. Do remember there are two questions which came from this part recently. First question, you gave pentavalent or DPT vaccine to a child and child have unconsolable cry. So after this problem of unconsolable cry, what will you do in the next visit? First option, don't give DPT, give pentavalent, give DT, give TT. Which thing will you do? Unconsolable cry or convulsion? These are two major side effects which occur due to pertussis component only. So pertussis is the responsible thing. In the next visit, we will give DT. We will not give pertussis thing. Simple. Give DT. Okay. Second question. What is the drug of choice? In pediatric, they have asked. In pediatric cases, what is the drug of choice for diphtheria and pertussis both? Pertussis and diphtheria both. Do remember, in diphtheria and pertussis both, in pediatric cases, the drug of choice is azithromycin. दोनों का एक ही आंसर है, डिप्थीरिया का भी pertussis का भी. And in adult, the drug of choice is erythromycin. Okay, और बुल स्नेक डिप्थीरिया में है, याद रखना. चलो, प्रोजेक्ट मोनिका. What is मोनिका? मोनिका stand for monitoring of trend and determinant of cardiovascular disease. एक बार एग्जाम में इसका फुल फॉर्म भी पूछ दिया है, तो याद रखना. ट्रेंड एंड डिटर्मिनेंट्स ऑफ कार्डियोवैस्कुलर डिजीज, है ना, यू नो कार्डियोवैस्कुलर डिजीज. तो इसका नाम जरूर किसी ठरकी ने रखा होगा या तो मोनिका के लवर ने रखा होगा. उसने यहां से उठाया मोनी और यहां से उठा लिया कार्डियोवैस्कुलर का का और बना दिया मोनिका. तो मोनिका इज फॉर कार्डियोवैस्कुलर डिजीज. इन दिस मोनिका सर्वे ए लार्ज नंबर ऑफ पीपल वेयर आस्क्ड कि क्या तुम सुट्टा पीते हो, क्या तुम दारू पीते हो, क्या तुम्हें हाई बीपी है ना, डू यू हैव हाइपरटेंशन, डू यू स्मोक, ड्रिंक एंड ऑल दिस क्वेश्चन. So we are asking question from a large number of people. That means it is which type of study? It is cross-sectional study. Cross-sectional is Monica. Similarly, they ask what is Framingham Hurt study and Doll and Hill study. So Framingham and Doll and Hill study, they both were cohort study. Doll and Hill proved smoking causes lung cancer, and Framingham Hurt study was done on doctors for 54 years. It proved that what are the risk factor for heart attack. Okay, so these both were cohort, and cohort is also known as longitudinal or prospective. Okay, which of the following compound is mainly responsible for disinfecting power of bleaching powder? Hypochlorous acid, HOCl -1- is responsible for disinfecting action. कैसे याद करोगे? जिसमें रस है, जूस है, वो ज्यादा बैक्टीरिया मारेगा. रस is killing more bacteria. 1- is more responsible. The difference between, so यहां पे इन्होंने difference पूछा है, माइनस कर दिया. Incidence of exposed, incidence of non-exposed. If they will subtract, answer is attributable risk. If in place of difference they read incidence of exposed to incidence of non-exposed, then answer was relative risk. Okay. In sustainable development goal, what is the target for MMR? Less than 70. This is the target for MMR. Now, according to Factory Act, what is the maximum work hour per week, including overtime? Can you answer it? Including overtime, what is the maximum work? If they use the word including overtime, answer is 60 hours. But suppose they say only maximum hour per week. Maximum hour per week. Without writing overtime, answer will be 48. And if they say maximum hour per day, answer is 9. It is written in Park. But night include 1 hour of break. Including 1 hour of break. Okay? And what is the duration of maternity benefit? Is it 24 week, 26 week, 28 week? Answer is 26 week. Maternity benefit 26 week, 100% salary. What is the best time to do blood sugar in pregnant female? 28 week is the best time to do random blood sugar in pregnancy. Okay, best time. Now, remember, there are 3 benefits: sickness benefit, extended sickness benefit, and enhanced sickness benefit. These are 3 different things. Enhanced sickness benefit is for cutting the wire. Vasectomy, tubectomy, 7 day, 14 day. Extended sickness benefit is 2 year with 80% salary because it is given for 34 registered serious disease. Sickness benefit is only 91 day, and in sickness benefit there is 70% of salary. Okay, so do remember these things. Which of the following was launched to ensure complete immunization? That was definitely Mission Indradhanush. But what is Indradhanush scheme? Indradhanush scheme means 7 day, 7 different color bed set. Where? In Siddiq bedroom? No, in government hospital. 7 days, 7 different color bed sheet. Okay, in government hospital. That is Indradhanush scheme. Now, many times we get confused between Ujwala, Ujjavala and all. It is so simple. You will never be confused if you just focus here one time. When we write Ujjavala, Ujjavala, there is a jaw in Ujjavala. Jaw. Jabda hai. And what is the role of jaw? Role of jaw is to catch the food, chew it and bring it to the stomach. So similarly, Ujjavala is to prevent child who are trafficked and bring them back to home. So Ujjavala is child trafficking prevention and rehabilitation. Okay, this is child trafficking prevention and rehabilitation. And when it is Ujwala without the jaw, that is LPG cylinder with one-time gas to BPL category people. Okay, child trafficking prevention and rehabilitation is Ujjavala. Okay, do remember it. Chalo, no, next. Which of the following example of prospective? अभी बात किया है. Prospective बोलूं, longitudinal बोलूं, या cohort बोल दूं, incidence study बोल दूं. These all are the other name of cohort. So, which of the following is prospective screening? Screening of immigrants to a country. देखो, if you will go to Scandinavian country like Netherlands and all, Norway and all, they will keep taking your X-ray for 5-10 years in the future also to detect latent hidden tuberculosis in you. So this is a study which is going on in future 5-10 years. So this is which type of study? Cohort, future. So we call it longitudinal or incidence study. Okay? In future. Remember, these days in exam, they are giving a lot of question with this word, that written work record data is compared. If any question you find this thing, written record or written data compared, this means they are not talking about normal cohort, written work record, they are talking about historical cohort or retrospective cohort. So be very alert when this type of word come. Historical or retrospective cohort, they compare past written record. Retrospective cohort. So you can remember it by the mnemonic RH. Retrospective cohort and historical. They are comparing past written record. But suppose along with past written record, they also have future follow-up. Past written record and future follow-up. Both are there. Then they are going in both the direction, back and forth both. So that's why you call it mixed cohort. Other name is ambispective cohort. And third name is nested case control. Mixed, you understand. पीछे भी जा रहे हैं, आगे भी तो mixed है. Ambispective, you understand. पीछे भी जा रहे हैं, आगे भी both directions, so ambispective. Why they call it nested case control? Because out of these two work, collecting past data and future follow-up, which one is more time-taking and difficult? Future follow-up is more time-taking, difficult. Past data can be collected by a click of computer. So main thing we are doing in cohort, and in that cohort, we are inserting data of past. Case control ने घोंसला बना लिया है cohort में. And in the cohort, past data is inserted, so we call it nested case control. So these are the three names: mixed, ambispective, nested. जिसमें पीछे भी जाते हैं, आगे भी. केवल पीछे लिया तो retrospective और historical. Mnemonic to remember it is RH positive man. है ना? क्योंकि man जब RH positive होगा तभी erythroblastosis fetalis होगा. Okay? So do remember it. And these are some of the important topics and questions which I was willing to discuss in this session. But please do see that first part. 100 सवाल बेमिसाल first episode, which was very accurate guess of your question, and question can come from that first. So those two sessions are really useful. If you have any question, any doubt which you want to share or you want to say, you can always call me, message me on my number, or you can call, give your message on Alan Next app, and you will get the answer. And in this exam time, I just have two things to say to you. First thing, that on the last day, when you are about to go for the exam and all, one of the students who succeed, he told me this secret, that read only the chapter, the area in which you are strong. So that way your confidence will be good, and if your confidence is good, you can do very well in the exam. So in the last day, do not read the whole thing or unwritten thing. Just read that area in which you are strong, do PYQ of that subject, and you will be confident in the exam. Second advice to all of you is that every day, start your day by PYQs and then go for theory. Do not just keep doing theory. Along with it, I would just say that focus on your day work. If everyday work is good, result will anyway be good. And smile and enjoy the journey which you have, because in future, you will be very proud of this moment when you worked hard, you controlled yourself and gave your best. Okay, so this is a part which will make you proud in the future. So we will meet next time. Till then, hasta la vista, das vidania. Thank you so much. Let me know if I can help you in any way or anything which I can do for you. Thank you so much, my dear friend.